Good morning, everybody. You're all very welcome to Founders Day 2025. The theme of this morning and this afternoon's conference is mental health in turbulent times. So we'll be covering a lot of topics: the impact of global megatrends on youth mental health, digital determinants of mental health, psychiatry in humanitarian emergencies, climate distress and effective responses, and crucially, building resilience in the face of rapid change, because we'll definitely need to focus on that when we've gone through everything else across the day. So Founders Day, as you may or may not know, is held each year to recognise the pioneering legacy of the founder of St. Patrick's Mental Health Services, Jonathan Swift. Today, we're going to have a keynote address and then two themed sessions. The morning session is going to look at youth mental health, and the afternoon session is going to focus on protecting mental health in unprecedented times. Now, unfortunately, due to unforeseen circumstances, there has been a slight change to the schedule, and Dr. Owen Gallivan is no longer able to join us for the second session, but Dr. Iryna Mazhak is going to ably step in and give us a presentation in addition to being on the discussion panel later. So just to do a little bit of housekeeping, the accessibility requirements: if you turn on closed captions in Zoom, you can click on the live transcript function in the Zoom window if you want to get some sort of subtitles as we go through. Also, we love to get your questions during these events, and they're always really valuable and contribute to the discussion and to the value that everybody gets out of the content that we go through today. So if you ask your questions throughout using the Q&A box at the bottom of the screen, we can sometimes miss things if they're in chat. So if you put them in the Q&A box, then, and if it is for a particular person, if you can @ that person's name and we'll know who it is you want to direct it to. I'm hoping we get time to go through lots of them. If there's little bits of time at the end of presentations, we can put questions to people, but otherwise I'll collate them all and we can go through them at the panel discussion or afterwards. So please do contribute your questions. The CPD certification, that's what I wanted to go through as well, is available from the Psychological Society of Ireland, the Irish College of General Practitioners, which is transferable to the College of Psychiatrists of Ireland, and the Irish Association of Counselling and Psychotherapy. So CPD certs will be automatically sent to anyone who's attending live today for the full conference and has requested them. But if you just allow around 6 weeks for receipt of those certificates. Now, you can follow along with the conference on our social media channels, which are being shared in the chat box as well as we go through the day. So just to give you a quick overview, we're going to begin shortly with the keynote address, which is by Peter Hughes, who's a consultant psychiatrist with the NHS. Then in session 1, we'll have Aibhlín O'Leary, who's head of advocacy and public policy with UNICEF Ireland. Then Professor Barbara Dooley, emeritus professor of psychology at UCD. Then Alex Cooney, who's CEO of CyberSafeKids, and Morag, Hewett, who's youth advisor at the Compassion Project. Then for session 2, Nick Henderson, the CEO of the Irish Refugee Council, will be joining us. And then, as I mentioned, Dr. Iryna Mazhak, the Associate Professor of Sociology at the National University of Kyiv, will be joining us. So that's it for the moment in terms of housekeeping. So I really hope you get a lot out of the day. I've no doubt you will. It's very much a timely conference in terms of the content we're going to be covering. And as I say, please do feel free to be active in the chat and put in questions throughout, and it really adds to the day. So without further ado, we'll get started, and I'm going to hand you over to be formally welcomed to the conference and to formally get us underway, CEO of St. Patrick's Mental Health Services, Dr. Paul Gilligan.
Thanks very much, Jan. With the last few years marked by economic uncertainty, international conflict, and an accelerating pace of change, this year's Founders Day conference is a timely opportunity to not only acknowledge the difficult times we are living in, but to explore ways in which we, as mental health professionals, can support and strengthen effective solutions and build resilience as we navigate the challenges we are faced with both nationally and globally. In particular, we must focus on the impact of these times on our children and young people. Turbulent times affect children more profoundly than any other group. Across the world, children's rights and human rights more broadly are increasingly challenged. Here in Ireland, children and adolescents are navigating unprecedented pressures, from the mental health impact of global conflicts and climate instability to online abuse and the complex challenges of identity and belonging. Many parents feel overwhelmed and unsure how best to support their children. And too often, society's response is to criticise young people for lacking resilience rather than strengthening the systems meant to support them. And this is why the theme of today's Founders Day is so important. Throughout the day, the variety of topics covered demonstrates how conflict, crises, climate change, and online-based abuse can and is causing profound trauma. But more importantly, through the contributions of today's speakers who have kindly volunteered their time and expertise, today's conference provides an opportunity to explore effective solutions that protect and enhance our human rights and contribute towards building resilience. I want to thank all of the speakers for providing us with this very important input. And I also want to thank Professor Paul Fearon, Tamara Nolan, Sinead Mack, Janny Flanagan, and the Founders Day Committee for choosing such an important topic and for organising such an important event. At St. Patrick's Mental Health Services, human rights-based care has been central to our work for nearly 2 decades. We do this not only because it is the most effective form of care and empowers people who may already feel disempowered by mental health challenges, but also because it's the right thing to do. Upholding dignity and ensuring people have the information they need to make informed choices strengthens the services we provide and ensures every person, especially young people, can be supported through turbulent times. We've all been witnessing the world stepping back from acknowledging and protecting even the most basic of human rights, and Ireland is no exception. Mental health is no exception. It is therefore vital that today not only reinforces for us the mental health impacts of conflict and challenge, but also provides us with a call to action on human rights, particularly in mental health care and on children's rights. The action required is to ensure each one of us leads the way in terms of human rights-based practice, that we call out policies and practice that are not human rights-based, that we seek to change the hearts and minds of others. It's imperative that we proactively seek to meet, protect and advocate for the human rights of those in our care and not wait for them to seek them. When we protect the rights of the most vulnerable, we not only safeguard individual well-being, but contribute to a wider culture of respect, inclusion and safety. Events like today's remind us that together we can strengthen services, support families, and uphold the values that guide our work, helping children, young people, and communities navigate uncertainty while promoting resilience and hope. Jonathan Swift, the founder of St. Patrick's Hospital, was one of the strongest advocates for the human rights of the most vulnerable in his day. The challenges were different then, the cause was the same. Today, all of us in mental health care walk in the shoes of Jonathan Swift. We are fighting the same causes under different but equally turbulent conditions. I want to finish now by saying that I know you will join me in reaffirming all of our shared goals, which is to provide the highest quality human rights-based mental health care, to build awareness of mental health, and to advocate for the rights of those experiencing mental health difficulties. Thank you.
Thanks, Paul, for that. And we're going to now pass you on to the Medical Director of St. Patrick's Mental Health Services, Paul Fearon.
Great, Jan, thank you very much. And thank you very much, Paul, for that introduction. I'd like to, like Paul has done, welcome you all to today's Founders Day. The Founders Day Committee usually meet earlier in the year, and one of our first decisions to make is what the theme of this year's Founders Day is going to be. Sometimes that can be difficult, either because there are a few competing topics, or, as in this case, a convergence of what may appear like disparate themes, but are actually tied together by one common theme, which is that we're living in uncertain times at the moment. And having discussed the various options, we decided that we needed to include all of these things because they're very timely, they're very important, they cut across society and societies. So during the course of this morning's Founders Day, we're going to be touching on the effects of the current situation globally and nationally on young people, global mental health. We have a keynote speaker, Peter Hughes, who'll be speaking shortly about his experiences working in zones of conflict, and we'll be talking about climate change and the experience of refugees. And of course, these aren't separate themes. These all merge and interlink. You can't talk about the effects of climate change without talking about young people, without talking about the experiences of refugees. So we hope that despite the fact that the session is quite full, we felt we couldn't leave any of these out. And I hope you'll enjoy the experience and get something from it. We'll be hearing about of data from UNICEF and other organisations, the Irish Refugee Council, etc., and also initiatives that have proactively been set up to try and address some of these issues. I'm just going to, one other housekeeping thing, I'd be very keen for you all to fill out the feedback forms at the end of Founders Day. We really do look at them and take on board any comments for future Founders Day. So I'd like to thank in advance all of the speakers and contributors, the Founders Day Committee, Paul, our CEO, and I'm going to now introduce Mary Butler, Minister Mary Butler. She's been a great friend of Founders Day over the last 6 years. She can't unfortunately be here live today, but she's taken the time to give us a video introduction. And as you know, has been for some time the Minister with responsibility for mental health in the government. She's also the government Chief Whip. So without any further delay, I'm going to hand over to Minister Mary Butler. Thank you very much, everybody, and I hope you enjoy the day.
Hello, everyone, and thank you for the opportunity to address St. Patrick's Mental Health Services Annual Founders Day Conference. And my thanks to Professor Paul Fearon for the invitation. I think this must be my 6th time doing this address. It was an honour for me to be reappointed as Minister for Mental Health by the Taoiseach in January of this year. And it's a huge honour for me that mental health is represented at the Cabinet table for the first time ever. This milestone signals the government's commitment to making mental health a priority. Founders Day reminds us of Jonathan Swift's vision nearly 3 centuries ago that those with mental health difficulties deserve care, compassion, and a voice. While these principles endure, our responses must evolve to meet changing needs. The theme of this year's conference, Mental Health in Turbulent Times, is very timely. Global challenges, conflict, climate breakdown, and technology all impact mental health. We must work together to protect individuals and build an inclusive society that supports people in crisis. Lived experience is central to shaping services. St. Patrick's has led the way in embedding this approach, ensuring recovery and meaningful lives remain at the heart of care, but most importantly, to end the stigma. As Minister, my priority is to advance ambitious policies, expand services, and modernise legislation. We are building a system that promotes resilience and recovery through a person-centred, rights-based approach, and we all have to remember that recovery is possible. Progress is evident, and we will soon conclude all stages of the Mental Health Bill 2024 in the Shannon. We are making significant progress in implementing Sharing the Vision, our mental health policy, and we are developing a new suicide and self-harm reduction strategy to succeed connecting for life. Budget 2026 reflects this commitment with almost €1.6 billion allocated, 6th consecutive increase and over 50% higher than 2020. This includes hiring 300 additional staff next year, representing 9% of overall health workforce growth across the HSE. We're investing in new crisis nursing support teams in emergency departments and establishing 3 new crisis resolution services. We are further developing all of our national clinical programmes, and we are prioritising prevention and early intervention by expanding access to talk therapies, early intervention for youth mental health, and investing in digital mental health. This year I secured €2 million, which was allocated for counselling support for men, to provide over 15,000 free sessions accessed through GPs and yourmentalhealth.ie/men. Uptake is strong with over 1,400 new male clients in SIPSI and 150 through My Mind since the launch. For young people, though, we launched the Navigator tool in June, a dynamic signposting platform for ages 14 to 34, offering anonymous, immediate access to mental health resources and 24/7 support. Since its launch, nearly 30,000 sessions have taken place with 26,000 new users, so I'm really pleased about that. CAMHS remains a priority with €180 million in funding this year and €110 million for community-based mental health organisations, much of it focused on children and young people. This investment underscores our commitment to youth mental health. Earlier this year, I visited all the HSE regional health areas to focus on reducing CAMHS waiting lists, especially for those waiting over 12 months, and ensuring all approved posts are recruited and filled in a timely manner. I commend CAMHS staff for their dedication and the compassionate care that they provide on a daily basis. I also want to acknowledge St. Patrick's partnership with the HSE in providing high quality care and support of people who require access to your specialist services. Looking ahead, I will continue working with all stakeholders in mental health to make services more connected, accessible and responsive. This includes stronger links with primary care and disability services and greater use of digital supports. Conversations like today's are essential. It is actually inspiring to know so many of you are in a room and are committed to using today's events to advance mental health, especially in these turbulent times. As I say every day, there is no health without mental health. Thank you again for inviting me to speak, and I'm sorry I cannot be with you in person today. I do look forward to continuing our partnership in the years ahead. Gorv míle maith go léir.
Hi everybody, you're all very welcome back. I hope you're all sufficiently caffeinated and ready to undertake the presentations for today's conference. So our first speaker, our keynote speaker, is Dr. Peter Hughes, who's a consultant psychiatrist with the NHS. And to formally welcome Dr. Hughes, I'm going to hand you over to Medical Director of St. Patrick's Mental Health Services, Paul Fearon.
Thank you very much, Jan. And I'm really delighted to be able to welcome Peter to give the keynote address at today's Founders Day. You'll have read his biographical notes, which capture something of him. He's worked for decades now in over 30 countries in developing and underdeveloped countries where there's strife, and he's been doing that for a long time. He's very active in the Royal College of Psychiatrists, both in terms of global mental health and in terms of the interface between primary care and psychiatric services. That only captures part of Peter, and he's been way too modest in his biographical details, and I'm going to embarrass him now prior to handing over to him. Peter, earlier this year, got probably the most prestigious award that the college can offer. He got the Lifetime Achievement Award, which really reflects a lifetime's body of work, and of course it's not over yet, his work. He's still going strong, and this is quite a big event with the college. They produce a video with lots of people singing the person's praises. Perhaps the one that stood out for me, partly because it was also, I should mention, Peter and I were in the same class in medical school in the 80s, so I've known Peter for quite some time. But another one of our colleagues who also is an NHS psychiatrist based in London, Peter Byrne, probably had the best response to this, which was finally the college has got something right. And I think that's very true. There could be no more deserving recipient of the award this year. Again, I'm going to embarrass Peter further. We have a class WhatsApp group, and some time back, we're at an age now where we're not facing retirement imminently, but it's beginning to come onto the horizon. So one of our colleagues asked, has anybody started cutting back on their work? And we had about 7 or 8 colleagues immediately who said, yeah, I've cut back to 3 days a week, or I've got rid of my admin things, or I'm slowly gliding. And Peter, with his usual pithy style, just said, actually, I've started 3 new jobs in the last month. And I think that says an awful lot about Peter. I know from colleagues in the UK who know Peter that he's also regarded, quite rightly, with almost hero worship status by junior doctors who work with him and who know of him because of the work that he does, both nationally, but particularly traveling to so many places where there's strife, and trying to develop and set up and help the obvious mental health difficulties that people can be in such zones. Paul Gilligan mentioned earlier about the importance of doing the right thing in a slightly different context. And I think, again, Peter embodies the idea of doing the right thing. He has a set of skills, and from a very early stage in his career, he clearly thought, what is the right thing to do with these skills? And he continues to do it. So I'm delighted, as I said, to hand over to Peter now. He's going to be talking to us about learning from humanitarian emergencies in daily clinical practice. So I'll hand over to you, Peter, if I haven't embarrassed you enough. Thanks very much.
I am so embarrassed with you, and it's very nice to see you again after a long time. I'm going to have the first struggle, which is trying to share my slides, which I can never ever manage. Oh yes, I've got them here. So I have to check now if people can see what I'm seeing. And if not, because I work in places where electricity goes very
We can see them, Peter. It's fine. Yeah.
Okay. So, yeah, I'm not going to be, the slides are kind of just to remind me about what to speak about. And I wanted really to think something I've been thinking about in all my emergencies is about resilience and hope. And people think that, may come to this field thinking that people are all victims, they've all got PTSD, whereas in fact, what I get a lot is the message of hope and resilience, which I really think is something I can take back to my work in the UK. Now, my bio, I've been around a long time, done very different things. I'm currently working for Iran, developing their emergency response. And I go to terrible, horrible places a lot of the time. But last week I was in Bahrain, which was very nice. So sometimes I get to quite nice places. I will, oh yes, I just plug my book about volunteering in global mental health. And the profits go to volunteering. So I think I'm entitled to plug it. So just to mention I've worked in quite a lot of countries, mostly low-income countries, but high-income countries as well, and the need for mental health, of course, is universal. Although when I went to North Korea many years ago, they had an official policy that mental health wasn't, they didn't have any people with mental illness in North Korea. Since then, they now will agree that there is mental health problems, and there certainly was when I saw that when I was there. So I've worked in a lot of countries in terrible problems. My most recent big project was working in Al Hol camp in the Islamic State group in northeast Syria. And even there was resilience, there was hope, as well as despair, and a very unique experience, quite a privilege in some ways. I've worked in Gaza, and these are places that I put these slides in because there was hope then. And hope depends on the people there and their resilience and their future strengths. And these are the people who I remember who were so kind and good to me. And this is the future of Gaza. The same for Sudan. I've done a lot of work in Sudan, and the war is catastrophic, of course, but again, there's great people there, and these people there will come through. Ukraine has been an amazing example of a place where I was there mainly before the war, and they really built up their health services so well in mental health, so that when the war came, it was really much easier to set something really impressive in place. Another book I'll just plug, which is by the person who brought me into this field really is Lynn Jones, Outside the Asylum. And I'm not a marketing or promoter person, but I just know this is a great book and talks about some of our mutual experiences and gives you a flavor of what this type of work in humanitarian emergency psychiatry is like. So my main type of work has been in emergencies. And this, for example, 800 people were living in this building before it collapsed. This was a 2010 earthquake, a long time ago, but it changed the way we dealt with emergencies. We learned such a lot, changed me personally, professionally, in every way. There's climate change, and I'm working with Iran at the moment, where they've had huge drought problem in Tehran, increasingly an issue. Wars and conflicts, I think is obvious. One of my experiences in the past was working at Ebola, so health and epidemics, and of course we all know the emergency of COVID. I don't need to tell people about that. But there is a message of hope. There's one document from WHO about building back better. And I've been in places which had wars and now they're better, like Sierra Leone, like Liberia. Ukraine is better in terms of its mental health. There's about 10 case studies in this document, which are very inspiring, including Sri Lanka is probably one of the greatest examples. It does also have Afghanistan, and I'm not quite sure how good that is really as an example. There are some misconceptions about global mental health, and I had these when I first started. I thought it's going to be about PTSD and about trauma, and it's not. Working in emergencies is about basic needs. It's about loss and grief. It's not about medicines like in the Haiti earthquake. I prescribed medicine so rarely, but it was just about sitting with people, all the psychosocial interventions, which is what I've taken back with me to my work back in the West as well. Just some other things. We know quite a lot. There's quite a lot of evidence base for knowing things. So in emergency, we know roughly what are the figures for mental disorder. We know that mental disorder does increase after emergencies or earthquakes, or natural disasters, etc. And I've seen this. I've seen in earthquakes really discordantly people being quite manic and very strange, to people being laughing and smiling, whatever, when they've lost their homes and their families. You'll see that PTSD, which people might think is the main thing in emergencies, is 13%. So high, but not overwhelmingly high. So you can't do anything in mental health until basic needs are met. So in my experiences working in emergencies, I've become an expert on different type of tents, how to get people a shelter for the night, how people can get some money to get their bus to go to visit their family when they've got no home. I'll always ask people, have you got a safe place to go tonight to stay? Have you got food? I take that back to my work here as well. And the other thing is that people are not passive victims, but of amazing resilience. And I do think that I always think that that around the world, people have such strength. They get strength from their families and communities. They get strength from their religion. I'm always a bit worried. I'm not a religious person, but I'm always a bit worried about people who say, I hate God, I'm turned against God, I don't believe in God anymore, because that's kind of different to what the strengths are in that community. So I pay special attention to those people to make sure they're okay. Culture can't be underestimated, and I have made this mistakes time and time again of not understanding the culture. I've been to South Sudan so many times, but it was just on the last trip when I went on a project which was about peace building, that I really realized that it's all about cattle. And South Sudanese people love their cattle. If the cow dies, it's like a bereavement in the family. And you've got to really know that. This big warfare, a lot of it can be about cattle, and it's as simple as that. And you've got to understand that. And each place will have its own culture. And I will, as an outsider, may not get it. It took me loads of times to get the cattle issue in South Sudan. This is kind of what, when I first went to Somaliland, this is what I saw, which is people chained up and in a hospital, psychiatric hospital. Now, the last time I went there, no one was chained up. Again, a message of hope. Other places, Sierra Leone, first went there, people were chained up, and now that's totally changed. So improvements in mental health, and this is about human rights and respect and dignity for people. This is kind of the nice image of mental health that a lot of global mental health is about. It's about psychosocial interventions, about listening skills, good communication, dealing in a public health point of view, which is dealing with people with anxiety and depression. For a psychiatrist, probably we're dealing with the more severe end, but public health, there's much more people who are in need of psychosocial interventions, like people with good listening skills. And this example I mentioned from Zimbabwe, where they have the friendship bench, which is a lovely intervention where they have a person in the village, like a grandmother usually, who they skill up in problem solving. She sits on the bench outside the health center, and people can come and sit with her and talk through their problems, and she listens and does some problem solving. And of course, problem solving is about the person, the patient or the client, solving their own problems. You're not there to tell the person what to do, which is why you need to train the people providing this very well, not to rush in with unrealistic problem-solving things. Now, a lot of the work in the past couple of decades has been about moving from psychiatrists to task shifting so that other people can deal with mental health, because there just isn't enough psychiatrists. Currently, when I lived in Chad, there was 2 psychiatrists. I was one of them. Now there are no psychiatrists. In a place like India, you'll get lots of psychiatrists, but they all live in acidic cities generally, so you don't have access to mental health. So we realize that from a public health point of view, you can't rely on psychiatrists, much as how we have our role, but you need other people to deliver mental health, and where it's more accessible and less stigmatizing, like in a primary care center. And the big message about primary healthcare, our public mental health, is it's all about depression. And when I'm doing my trainings around the world, my saying is, no doctor or health worker should ever miss depression. And is it missed? Absolutely. I've seen so many clear cases of depression that were missed in primary care. Like I remember a case in Uganda where clearly people waiting had depression, but they were coming in with headaches or stomach pain or something like this, and it was being missed. So I'll just mention one of the things I've been very involved with is the MHGAP program. And this is a tool for delivering mental health by primary care doctors or health workers. In sub-Saharan Africa, we do quite a lot of work with nurses, getting them to deliver the mental health. In other countries, like in Bahrain, I've just been in, we're training primary care doctors. And MHGAP, please look it up. I learn something from it every day, and I use this in my practice all the time. This is a humanitarian version, and it covers depression, anxiety, PTSD, substance use. These are the things you see day to day in emergencies. Oh, and the other one I should really emphasize is grief. I've spent a lot of time in emergencies supporting people with grief, supporting how we can organize, how we can support people have funerals, especially when there was no body available. I'll mention psychological first aid, which is something I again use back in the UK, which is a way of dealing with people in distress. And it's about look, listen, and link. I'll just give you an example from Haiti. I used to see girls who'd been raped every day of the week. They'd come in, I'd look at them, I'd check to see what their basic needs are being met. Of course, I'd ask if they wanted to see a male doctor, but when you ask that, they kind of say, yes, it's okay to speak to me. Listen to them and link them with supports, which in the case of rape will be making sure they've got a safe place to stay that night, and that if they ever wanted to go to the police or health services, that we would physically help them with that. So just to talk a bit about field examples, and I put this picture up, which reminds me that as a humanitarian expert in the world, I'm there as a guest. And these were people I worked with in Darfur who were the refugee workers. They knew the camp. They knew everyone. They were the key. And they were able to provide so much of the help and support. And they were wonderful colleagues. I always think about them because I think they're still in the same situation, living in the camps, which is really harsh life. Now, this is kind of a disturbing slide from the first week in the Haiti earthquake in 2010. It was overwhelming. It transformed my life. But this is when the morgue was full up and there was bodies everywhere. The nursing school in front of where I stayed, where we had 100 nurses, were killed. We had outpatients that we set up in these tents because there was an increase of mental health problems. Now, going on to some other examples, the Rohingya in Bangladesh, where we did I was involved in quite a lot of work in training primary care people in mental health. And one thing I'll say, for a Rohingya, they could see a psychologist within a week. To see a psychiatrist would be much harder, but to see a psychologist within a week. Now, I think you can look at Ireland and Britain here. You're not going to see a psychologist within a week. So in some ways, we've got a lot to learn from from other places. Afghanistan is a place I've been involved with for many years, and a real place, one of my special places that I really love, and we've done a lot of training. And this slide was another trip where you'll see that we had a lot of women in the participants, and we really wanted to encourage women to be leading in terms of mental health. Now, every day I was there, the Taliban had something bad, that they stopped women being able to go to parks. I was in a wonderful women's university, and then they closed it. Women would come into the training and they were crying because, again, I get emails from Afghanistan all the time asking, how can we leave? Not just for them, but for their daughters. But I would go back to Afghanistan tomorrow. So when you're working in this kind of work, you work sometimes with people who you may not agree with all their views, and this is like working with the Taliban. And I'll sometimes show this slide and say, who is the Taliban here? Well, it's the guy on the left, who is a really lovely guy. So you work with the Taliban because everyone is a human being, and you'll have some mutual areas of work. They're dealing with the women. Like, this guy knew that the way women were treated in Afghanistan was a problem. So another thing that was pretty transformative in my life was Nagorno-Karabakh, which I'd barely heard about. And I got very involved in this because I was doing a project across Armenia and Azerbaijan, who were in dispute about this enclave, which was in Azerbaijan. And there was a Peace for Health project, which was a really interesting thing, that they thought that doing a health intervention can bring about peace. Well, there is peace now. You can fly now. I feel like it was working quite at the time, because when I was there, it was Nagorno-Karabakh fell. So I was going between Armenia and Azerbaijan all the time, and Nagorno-Karabakh fell, and then I went from Armenia to Azerbaijan, and it was a very strange experience when you go to one country that's conquered another. But I put that slide up because Baku is so beautiful. And then we were working with primary care doctors in Azerbaijan, and the same thing with Armenia. And the experiences they described there were the same on both sides. Martyrs, Azerbaijan, the same in Armenia, the people who were killed. The Armenian rockets, yeah, there's the same in Armenia from Azerbaijan. And this was outside the UN office I worked in, protests every day. Oh yes, this is another example. We did some trainings outdoors. It was really beautiful, beautiful country. We engaged with the stakeholders throughout the country in Armenia. We did campaigns. And then one thing I showed this slide because it reminds me how important primary healthcare workers are. This primary healthcare center had one doctor. She knew everyone in the village. Everyone in the village would come to her with their problems, with their secrets. She was just amazing how she dealt with people, and really, really helpful to train her in dealing with mental health, although she was so skilled in her psychosocial skills anyway. The end of September, Nagorno-Karabakh fell, and I got called back to do an emergency response for Armenia. And this is some of the things I'm really so proud of. We set up a mobile mental health team. Within a few days, we had a child psychiatrist, we had an adult psychiatrist, social worker, psychologist, and we had someone from Nagorno-Karabakh who was there as well. We had a big project around burns because we had about 100 people had serious burns when Nagorno-Karabakh fell. We set that up in 2 or 3 days, which I think is really, we can learn from in other countries. A hotline. And now I'm just coming to Syria, which has been a place that I've worked in quite a bit over the years. So I did this training in the middle of the very bad war, so it was a very insecure place at that time. Now, next, I was working with the Yazidi people in Iraq, and I remember talking to a Yazidi man telling me about how his family had been, his daughters had been enslaved, had been raped. He'd seen family members being beheaded. He wanted to tell me this, and I do believe it helped him being able to talk about it. The next thing, I'm working with the perpetrators of this, the Islamic State group in northeast Syria, and also I had an experience with Islamic State where they had a very nasty incident in Afghanistan where, I guess I was lucky to survive that. So this was my work every day in Syria for a year, dealing with these women. And I knew they were from Islamic State, so it is a cult. But they were just humans like everyone else. Amazing that there was no addictions whatsoever. I don't think I ever saw a woman's face for the whole time I was there. The kids would still throw stones at us, but dealing one-to-one, people were really, really so nice to me. Quite a few of my patients who I'd see would bring me little gifts like toffees or sweets. And I was thinking, God, I'm taking toffees from Islamic State people. And had one Islamic State lady said, "Oh, you're like my father." And I thought, really, is that, I'm not sure how to take that, but as human beings, and the other thing about them, even though they're living in this terrible environment, is how to work with them to have some sort of hope, because they're stuck there. Now, religion became very important to them. Clearly, it's very important to them, but not for me to tell them about religion. But you know that that's what gives them their strength. Um, and this was our little haven for mental health. And the sorts of cases I saw there, anger, and I would have a typical case would be I'd be seeing a child bedwetting or something. And then I talked to the mother, and you'd find out that the father is either dead or in jail, and the whole family is depressed and in grief about things. So the lessons learned, oh yeah, I'll just give you one little thing that I use around the world, which can be helpful, and I'll bring it back to my practice here. This is a sort of a tool in psychosocial skills where every finger of the hand of the person you're working with, you remind them that that is a person that they have someone they can approach for help. So with the Islamic State women, it would be I can approach my sister, my mother, I can go to the sheikh. So this is to remind people that they're never alone. There's always someone they can talk to. So a tool of social mobilization. Now, the other thing is the lines of the hand, which can represent activities people can do. For Islamic State group, it would always be reading Quran or religious stuff. And that's fine if that's what helps them. That's just some activities, and this is kind of like a basic behavioral activation. The creases of the wrist are to remind, to give a message of hope. So I saw quite a lot of people with like romantic troubles in Syria, also Afghanistan. I don't know how they managed to have these secret romances, but they break up and they're distraught. And example would be the crease of the hand might be, remember how you survived before when you were, you had the strength to overcome things. So like this will be something I'll use for exam students. I'll say, well, remember that you passed your exams before. I use it for myself, or if I lose my keys, which I do all the time, remember, I find my keys. So lessons learned, kind of everyone is the same. Bad things bring out the worst and the best of people. So remember, the best comes out of people as well. Community and religion. The emergency mental health is not the psychiatrist. You have a much more general role, which might include looking at basic needs as well. It's about empowerment, but not you giving them empowerment. They're helping them being empowered themselves, because people feel better if they're able to look after themselves. Human rights, I can't underestimate. So it's not about PTSD, but it's a lot about loss and grief. And life goes on. I've been in some really horrible places, and people were still having engagement parties and weddings, and even in the worst things, people go on. So, oh yeah, this is just a slide of a woman in Ghana. She was chained up by her family for about 5 years because of her schizophrenia and her behavioral problems. We managed to get her treated. You can see she's smiling. She can't stand up because she's got contractures. So many stories around the world like that, but you can see there's hope and people can have a life and have a useful life, and etc. So I think that's it. Thank you. I think there may be a few minutes for questions.
Yes, thank you so much for that. That was really, really interesting. And thanks so much for sharing your experience and your expertise, which is incredibly generous of you. We have had some questions. I mean, I could probably talk to you for hours based on just what you've shared with us there. But some of the things that just struck me, you were saying at the beginning about some of your work, say in Haiti, post-earthquakes, and then working in, for example, Gaza and Ukraine. Have you noticed ever a difference in response when the emergency is natural versus man-made in the terms of war? Is there ever any noticeable difference in the response?
Yeah, I probably would say if I had to, one of the things that a lot of us humanitarian workers we're a bit allergic to PTSD, but I probably would say you might get a bit more PTSD in conflict areas because in earthquakes, everyone suffers the same. Um, Everyone loses their home, everyone loses parts of their family. And I've seen people in Haiti, for example, who had horrible stories like they were trapped under masonry for days and days. And then gradually the people screaming and shouting faded away as those people died. So, but they seem to survive but in conflict, it's a very different thing because it's man-made, and and people who are into individual kidnappings and things like that can be really, really very difficult because you don't have that shared community.
Sure. One of our attendees, Joan, was wondering around the use, say, of terms like mental health disorders or difficulties. Like, at what point does something cross the threshold from being a perfectly reasonable response to extraordinary circumstances and an enduring mental health disorder or difficulty?
Yeah, it takes a little bit of working out, but it's mostly you go in with the mindset to say people are amazingly resilient and they can manage themselves, they can look after themselves, and that sometimes they might need a little bit of help if they're overwhelmed. Um, in Haiti, for example, it was very clear when when people were clearly manic and laughing and screaming. There was one guy who was laughing and screaming and talking about starting up new businesses. And his son brought him there who had lost his leg. This guy who was manic, his wife had died, he'd lost his home. It was quite clear at that time, but it is nuanced because sometimes cultural factors can be really hard to work. In fact, I remember back in Ireland telling a traveller uh, woman, or yes, that her husband had died, and the whole family just went crazy and they started hitting me, hitting the nurses, hitting everyone. So there was kind of that stress response was so strong. And I think that was probably understandable for the circumstances. That's just what they did. In Haiti, for example, and other emergencies, we know ourselves as health workers that we all respond to stress in different ways, and that we all have our own coping methods, which sometimes are pathological or are fine. But yeah, I think I think people are universal, and the mental health conditions are quite universal.
I'm conscious as you were talking, I'm sure there are a number of our attendees who would share this with me and with many others, that it's increasingly difficult to, for example, watch news coverage of what's going on in Gaza, what's going on in Ukraine, etc. And I'm wondering, for somebody like you who has spent so long working in so many of these areas and on so many emergencies, how do you maintain your own mental health and your own resilience in the face of what feels like witnessing relentless human sorrow and suffering?
I just don't watch the news anymore. I can't. And I remember I was in a refugee boat in for Ukrainians a few years ago, and I saw like some of the old guys just sitting down watching the news constantly. And now one thing I'll tell people is just, avoid the news, just maybe the headlines, but don't just keep watching it because it will get you down.
Mm.
And I have to say that when I'm working overseas, I won't be reading Dostoevsky. I won't be reading something heavy. I'll always go for something extremely light. And thank God for Netflix as well. Yeah, I'm not a very cerebral person a lot of the time.
You can take a little mental holiday with these kind of
Absolutely.
escapist moments, which is good. I'm just looking in our question and answer box here, and Mary just wants to thank you for your wonderful insights into your amazing career. And she is wondering whether you see more psychosis in emergency situations and how you manage psychosis in those circumstances.
It's different in different places, I have to say. Like when I went to the Islamic State camp, I was the only psychiatrist. I saw very little psychosis there, and I thought I'd see a lot more. Um, in other countries, people with psychosis, particularly women, may get kept at home, even tied up at home, and you won't get to see them. But everywhere you go around the world, you'll see people clearly with psychosis in the markets, in the streets. So it is every country, even North Korea.
Danielle Hussey, it's not a question really, it's just to say she loves the message of hope and the idea of empowering people rather than dwelling on the trauma and emphasizing resilience. So,
yeah. And because that's what you find is that people often say, I don't really want to talk about what happened before. I want to talk about my housing. I want to talk about, my daughter's getting married and things like that. It's amazing. And I have to remind myself that you really have to follow not your agenda, but the agenda of the people that you're working with. And empowering as well. I'm not so comfortable with the word empowering because it kind of means that they're to be empowered. Yeah. So you're not to empower them. It comes from within.
Trish Martin is just saying here, fantastic work and so important, and the humanity of your work is, has really resonated with her. She says it seems to be all about a joined up piece, i.e. that services and people work closely together and from a biopsychosocial, sorry, that's just disappeared as I was mid-reading it.
I think this is one thing I've learned from is really putting physical and mental and social together, and spiritual, especially in Islamic State, where religion is so key to people. But in many countries in the world, religion is extremely important. Sometimes it's a bit inaccessible to me. Like in Haiti, they had voodoo religion, which I don't know very much about, but I recognize that was really important for people, and it was a real comfort for people.
Olivia found your presentation fascinating, and in contexts where psychiatric infrastructure is minimal, what frameworks guide your decision making in crisis situations? She's wondering.
Oh, you got to arrive, and then you kind of think of what's there already, and it's about you again being a guest, and you're building on what's there already. So, like one place I remember in Sierra Leone, we found there was some really well-respected people in the community who were doing problem solving, basically, although they wouldn't have called it problem solving. And we, as outsiders, had the resources to help them with. We paid their electricity bill. We paid for the shelter, and I thought that was like money well spent, because we're helping local people help themselves.
Yeah. I'm conscious I've kept you longer than you were supposed to be with us, Peter, but I think there was a lot of questions based on your presentations. People just found it so interesting. So I wonder, just as you leave, and as we're beginning now on the conference for the rest of the day with various different presentations and discussions, is there one key thing that you would recommend to people to sort of keep to the front of mind as we go through today, or one message that you would like to leave people with?
I think it is about hope and resilience. And I also would like to leave you the hand technique, which I think is so valuable. And if I was there in person, I'd be checking that you all knew the hand technique and getting to practice it and do it for yourselves.
Well, as you were showing it, I was literally here going with my hand, so it definitely works.
So I think that goes a long way in my work here, and it's been really one of the nice things. It always makes you remember about what people's lives are like. It's about like making sure their basic needs are met and their families and connections.
So much for your time, and I think from all of the comments in the chat and the questions and answers, you like take all of our best wishes with you as you continue your work, and best of luck with everything.
And I'm glad I'm not there in person to give everyone my cold.
Well, I did wonder, I didn't want to say it, but I was like, I wondered if Peter sounds a bit smothered. I hope he's okay. So I hope you're all
and I've been traveling so much around the world, and then I get it back here at home. But
of course. Well, mind yourself, and best of luck with your work going forward. And thanks so much for your time today.
Have a good rest of the day.
Thank you, Peter. Bye now. Bye-bye. Now, everyone, you're all very welcome back. We're going to begin session 1 of today's conference. And later, we'll be hearing from CEO of CyberSafeKids, Alex Cooney, on uncovering the realities of a digital childhood. Before that, we'll hear from Professor Barbara Dooley, Emeritus Professor of Psychology at UCD, and she'll be telling us about the growing youth mental health crisis in a changing world. But before that, we're going to hear from Aibhlín O'Leary, Head of Advocacy and Public Policy at UNICEF Ireland. And Aibhlín's going to talk to us about child well-being in an unpredictable world, sharing insights from UNICEF's report card 19 across high-income countries and Ireland. So Aibhlín, you're very welcome if you want to turn on your video there and we'll get started.
Perfect. Thanks so much, Jen. I'll just try and share my screen as well. Yeah, you can let me know if this is coming up okay.
Perfect.
Brilliant. Okay. Well, just to start, thank you so much for the invitation to be here today. It's a real honor to be at this event with such amazing speakers. I know, like everyone else, I was very inspired by our previous speaker and his amazing work. And personally, I'm just a big fan and supporter of St. Pat's, so it's a real honor to be here. I'm speaking today about, as Jan mentioned, UNICEF's global research report, report card 19, which was published in May of this year, and which whose theme really very much dovetails with the conference. So report card 19 looks at child well-being across high-income countries, including Ireland, so 43 countries, and using data from 2018 to 2022. So really covering that pandemic period, which obviously will shape the findings of the result of the report, and we'll delve into that in a little while. The report card covers multiple dimensions of child well-being, but obviously for today we will focus primarily on mental health. So I'm just going to start with this quote that opens the report, and which I think is quite evocative. So it's, "With the war, the epidemic and the weather, times are altogether troublesome." And it comes from Christabel, a 15-year-old girl in New Zealand, who wrote into her local paper. However, even though many of the challenges that Christabel mentions are very relevant for today and in recent years, as some of the wording might indicate, Christabel is not of our time. And this was actually written in 1919, so just after World War I, and with the onset of the Spanish influenza pandemic. And I think it's a timely reminder, I guess, of the enduring nature of challenges that we face, as humans and as society, that are constantly evolving, and we often hear headlines that things are worse than ever before, more challenging than ever before. And of course, there are real and drastic challenges facing children and society today. But it's worth remembering that that children and young people and societies have weathered those storms before as well. So as I said, report card 19, child wellbeing in an unpredictable world, really it aimed to give an emotional audit of how these 43 high-income countries, largely OECD countries, were doing for children, and how children in those countries were doing at 2022, so just coming out of the worst stages of the pandemic. And unfortunately, I suppose the main headline, the findings of the report are certainly mixed, and we'll go into that in detail. But I think what we can clearly see is that some of the hard-won progress that we have seen in child well-being in the last 20, 30 years is becoming increasingly vulnerable to global events and shocks. So since Christabel's time in 1919, we know there were major strides in terms of child well-being and including mental health. We're seeing some of that progress stagnate a little, I guess, in these recent times. And that's partially because, as referenced, children are growing up amid overlapping crises. So we call them the three C's here. So COVID obviously hopefully won't be returning in that same global pandemic and lockdown sense as we had it. We know that it's very much here to stay as a regular ailment for many. But in the period of this report, obviously COVID was an extremely disruptive force for children and young people, as well as older people around the world. Then conflict, as has already been referenced today extensively, you know, we see extensive and intensive conflicts right around the world, and we know, of course, that children are often suffering the greatest impacts of those conflicts. And then climate change and the impact of climate change is also wreaking havoc around the world, and not only in developing countries and development contexts, but also in high-income countries and our neighbours in Europe as well, if not quite here in Ireland. So those three C's are, you know, three really significant challenges that children and young people have been facing over the past number of years. And then within those, or sort of surrounding those three C's and three challenges, we also have these two other trends, the two D's, which are called digital technology and the digital transformation that is ongoing and rapidly progressing, and demographic change and the trends and shifts that we're seeing in that area. So between these three C's and two D's, we've got quite a complex picture emerging, you know, that children and young people are growing up in. So just to briefly, you know, sketch out Report Card 19. It's quite a long report, and it's obviously available online for you can get it there. But just to tell you a little bit about what the report was looking at. So it follows on from a previous report in 2018 that UNICEF and Echente had also published on child wellbeing. That was Report Card 16. So this is directly comparing those two data sets with some additional questions and additional markers. But really the questions that the report is asking are, you know, so what are those key factors that are affecting children's lives, and what can be done to promote child well-being within that space. So as I said, yeah, looking at that sort of 5-year period between 2018 2022, and trying to understand the trends that we're seeing. So just for a little bit more context in terms of the framing of the report, so UNICEF and Echente's analysis on child well-being is grounded in this framework, which essentially looks at the outcomes that are explored throughout the report. So mental well-being, skills, including academic skills, but also social skills, and physical health and well-being. So looking at those three outcomes in relation to the world of the child, which might be more immediate in terms of their kind of close family and their home life, then the world around the child, which would include their school, their communities, and then the world at large, which would be government and government policies and services. And this framework, you know, is used to try and bridge, I guess, that individual life of the child and those immediate outcomes with with a child rights framework. So we have here an animated version of the UN Convention on the Rights of the Child, which obviously is the Universal Convention for Children's Rights and underpins, you know, this research and all of our work. So the different dimensions that Report Card we're looking at, as I said, so mental well-being, physical health, and skills, divided into different components. For today, we'll focus mainly on life satisfaction and adolescent suicide under mental well-being. But of course, we know that that physical health, child mortality, and overweight and obesity, of course, interact with mental well-being as well, as do skills, particularly perhaps social skills in society. So just to show you, so this is the top 18. We have the longer version of them here, but this is the ranking, I guess, that was produced in Report Card 19, and what's very useful in report card each year, as Inocente examines a different aspect of child well-being, it shows us these comparisons and lets us see how different countries are doing in different dimensions. So you, like myself, might be surprised to see that Ireland is ranking on the basis of this data as number 5 out of 34 for child well-being. When we look at the different indicators and the different components, I think it gives a more complicated picture. So you can see that Ireland ranks first for skills. So that's in terms of academic skills and social skills overall, ranking first. Physical health 11, so not too bad, but falling to 24 for mental health. So I think our high ranking is somewhat masks that lower piece on mental health. But you can see the countries, the darker shaded blues are lower indicators essentially. And this is the full list here. So with Chile at 36. I'm conscious, I know this is probably quite small for you, but in terms of the changes in those 6 indicators, again, we'll look mainly at life satisfaction and suicide. The blue shaded cells are where there's been improvement. Orange is deterioration. Grey is where it stays stable. And white is where there was insufficient data. So again, I think when you first look at this, it looks quite mixed and maybe quite positive because there is quite a lot of blue. But if you were to remove those 2 columns of suicide and mortality, the rest of the indicators, life satisfaction, overweight, academic and social, are much more mixed. And certainly when we look at the trends in adolescent mental health in high income countries, we really see that coming to the fore. So you can see here that only Japan has actually is showing improvement in life satisfaction for young people within this 5-year period. Most other countries are showing, or many other countries are showing deterioration. Ireland is showing stable, but as we know from previously, that's a stable at quite a low rate. Briefly then, the report does look at adolescent suicide as one of these factors in terms of calculating child well-being. We're not seeing, hugely consistent data or patterns between different countries. There has been, I guess, a plateauing of long-term suicide rates amongst adolescents. In figure 4 on the right here, we can see that they've sort of gone over the last 25 years from a peak of 9.3 deaths per 100,000 down to 6.5 deaths per 100,000. But that drop, we arrived at that drop in 2007. So since then, it has really stagnated. And we know obviously that, that suicides are preventable deaths, and so this is a real area of concern. In terms of, yes, the changes in high life satisfaction. So as I said, the arrow there is Japan, and it's showing the only country in this data set where life satisfaction for 15-year-olds has actually improved. During this time, you'll see Ireland right next to it on the left, and Ireland has just dropped by 1 point in that time. So obviously, again, we're conscious with this report that, that of course this data was gathered in 2022. And as I said at the beginning, is therefore very much framed around the impact of the pandemic. And, it'll be interesting to see what the next set of data suggests in terms of those ongoing patterns. But of course, on a broader sense, we can look at the drivers of this decline amongst countries in terms of well-being, with things that I think we'd all be fairly familiar with from our own experience of COVID as well, and from our work with children and young people. But you're looking at loss of stable routines, reduced in-person peer relationships. Of course, school closures having a massive impact, both socially and also academically. Though again, we're not seeing that in the Irish context as much, where we're seeing those figures really maintained for a large percentage. Increased social comparison online, perhaps with a correlation to increased time spent online, and we'll come back to that. And then reduced access to support disadvantaged youths. And again, we know from other research that marginalised communities often suffered the greatest impacts from the pandemic. Seems to have cut off, but some factors then that we know are affecting adolescent life satisfaction and that are explored in the report include activities, relationships, networks, and resources. So this figure shows different levels of satisfaction across different criteria. So what we're really seeing here is that gender, it seems to be quite a significant factor. So with a 15% gap between boys and girls in terms of life satisfaction. And then family and peer relationships are also tend to be associated with strong variations in life satisfaction. These particular data sets, seems to indicate a low or relatively weak link between family socioeconomic status and life satisfaction. And again, that may be to do with some of those family relationships, but I think this data set is also limited in what it's looking at. And we know obviously from other qualitative data studies that that socioeconomic piece can be really, really critical. I'm conscious of time, but I do want to just briefly talk about social media use and children's life satisfaction. And I know this is going to be covered in much greater depth later during the day, but it was a particular point of focus within the report as well. And probably because of the amount of discourse around this at the moment. And what the report's findings showed was that in terms of well-being and life satisfaction for young people, it was less about, not necessarily about the amount of time young people spent online or on social media, but rather the types of engagement and the type of content that they were experiencing and seeing while they were on social media. And so actually what this figure shows is that moderate social media users would tend to have somewhat higher life satisfaction than either those who use social media intensively or those who don't use it at all. And it may not be as significant a factor in life satisfaction as some of the other areas looked at. But again, I think, as I said, I know the discussions will focus on this going forward. And I guess it really is that quality over quantity piece, perhaps. But just to briefly share that. So very quickly then, just focusing on the picture in Ireland and what the report card shows us, as well as what our own work with children and young people show us. So nearly 1 in 3 15-year-olds in Ireland report low life satisfaction. The adolescent suicide rate is slightly above international average, but not significantly. And separately on one of the other markers, we have quite a high percentage of children and adolescents who are living with overweight or obesity, so 25.7%. And again, we obviously know there are connections and links between physical health and mental well-being. So those are our results again. Interestingly, I just thought I'd share this as well, coming back to the family relationships piece, which showed that greater quantities of time spent with parents or other family members, and talking with parents regularly would also correlate to improved life satisfaction. And interestingly, Ireland did top this ranking here, despite our lower life satisfaction rates. And similarly for bullying, our rates would be comparatively average or standard, although again, you'll see here there was a significant drop in many countries on bullying, but I think we need to take into account the fact that the school closures would have possibly impacted that as well. So separately to report card, this is more, I guess, in our own conversations with young people, and we work a lot in primary schools and also with teenagers in our activism courses. But these are some of the things that young people tell us about mental health and their well-being. And the main thing is to listen to us or listen to them, and to include them in these conversations. I think the biggest topic of conversation last year in our courses was around the mobile phone pouches. And the young people were really, really angry that this money had been spent on what they felt was a really ineffective and, unhelpful tool, when instead they felt, they had so many ideas for what that €9 million could have been used for. Other things that come up frequently would be more services to reduce waiting lists, free services, free therapy, reducing academic pressure and workload. And I think there's a real correlation there for Ireland. Keeping children safe online, tackling things like skinny talk and their links to eating disorders, tackling gender-based violence. Again, this is something that comes up very frequently with girls and young women feeling unsafe in schools and in their communities and online. Multifunctional youth spaces and upholding children's rights for every child, including migrant children, children from asylum-seeking or refugee families, traveller children, children with disabilities. Every child has the same rights and they need to be upheld. I'm over time, but just very quickly, these were some of the recommendations. Report card, obviously, again, looking at so many different countries, those recommendations I think are quite general, but of course are still useful for our context. And in Ireland, some of our more specific recommendations were around, as we've discussed already, engaging young people and children in these discussions, increasing investment, improving our nutrition standards, and strengthening digital resilience and body image education. And that's it from me. Thank you so much, and happy to answer any questions now or afterwards.
Aibhlín, thanks so much for that. That was really, really interesting. Thanks a lot for sharing that with us. And I know you're generous enough to come back to us later on today to participate in the panel discussion. So maybe we'll put some questions to you then when people have had a chance to sort of digest your presentation in the context of everything else we're going to be talking about. But certainly I already have notes myself going, I must ask her about this. It's very interesting. So thank you for your time. And we'll move on now we'll chat to you later, and we'll move on now to our next. So we're going to continue now with our next presentation, which is with Professor Barbara Dooley, Emeritus Professor of Psychology at UCD. And Barbara's presentation is going to be around the growing youth mental health crisis in a changing world. You're very welcome, Professor Dooley. Thanks for joining us.
Good morning, everyone. I will start to share my slides. Firstly, can you see these?
Perfect. Yes, we can.
I'm just going to put them into presenter mode. Okay. Good morning, everybody. Thank you very much for speaking today at your annual Founders Day conference. It's a real honour to be invited. I've had many links with St. Patrick's over many years and different people, and it's a real honour to be invited. And to listen to some of the discussions earlier today has been absolutely fascinating. So I do feel a little bit of sometimes the imposter coming in after such great speakers before me, but I will endeavour to take us through maybe some things that I see are important in terms of the mental health of young people and how that's actually changing, and within the context of a turbulent world. So I'm going to focus in on the work that was done and presented in the Lancet Psychiatry Commission, which was published back in just over a year ago Now, 2024, which was led out by Professor Pat McGarry in Origin in Australia. And the commission was started, the work of that began in 2018. It was delayed, obviously. We've heard of many mentions of COVID. This also delayed this particular commission. But what it did do was bring 54 leading researchers from across the globe to look at youth mental health and the growing crisis in youth mental health. The goal of those researchers coming together was to analyse the factors affecting youth mental health and provide actionable recommendations for improvement. So people may be interested in reading this in depth because it is a very in-depth report, and I'll just dip into a couple of areas that in light of what we're here to talk about today, which is the growing crisis in young people. So apologies, my slides don't seem to be okay. Okay. So why should we focus on youth mental health? So that's the first thing. And if we look at, from a population perspective, 25% of the total global population comprises of young people, 10 to 24. So there's quite a huge proportion of people in this age range. In Ireland, 19% are aged 12 to 25, and that was the latest CSO figures from our 22 census. And we also know that adolescence and young adulthood is a peak time for the onset of mental health difficulties, and that has been evidenced across countries. And I think Peter talked about the universality of mental health difficulties earlier. And again, the profile of mental health difficulties peaking in around late adolescence is seen in many countries across the globe, not only in high-income countries, but also in low and middle-income countries. And we know from research that 75% of mental health difficulties that persist in adulthood emerge before the age of 25. So looking at the slide on the left-hand side, these are data from Ireland, data from 2022. So obviously, if you kind of project a bit forward, you'll see we've got what looks like bulge at age 12 in terms of population. So if you push this forward by 3 years, these are in and around maybe age 15 now. And these young people are now in that vulnerable potential time for developing or experiencing mental health difficulties. So we've had a huge increase in young people, and yet the services to support young people are not keeping a pace with the actual growth in our population. So again, this is just another way of looking at the importance of focusing on young people's mental health. So in the graph that we have here, the yellow mustard type part of the graph indicates the mental health disorders. And you'll see that there are mental disorders in childhood, but they tend to emerge and increase in early adolescence and peak in the late teens and early 20. And again, we see this, we've had data to map that in Ireland as well. So if a person is to have a medical condition, a young person is quite likely to be mental health rather than some of the other disorders that we may see in different age-related part of our population. So it's a really critical time for looking and supporting our young people. So if we look at the rising prevalence of youth mental health difficulties, so we've got high rates of mental health disorders among young people, beginning generally often beginning in adolescence, early adulthood. It's a principal cause of burden of disease in this age range. It has been deteriorating over the past 2 decades. The why of that is not fully determined, so the causality, but we do know it's increasing. It's a time where there is significant biological and physical changes in the brain and in the brain structure. And there are developmental challenges which are becoming increasingly complex and protracted, often influenced by megatrends. So the Commission is set out in 5 parts. Firstly, looking at the changing landscape of youth mental health. And there were 5 leads across these 5 areas, and I had the pleasure of working on area 1 with many researchers. The second was conceptual frameworks and trajectories, models of care, the economic imperative, and the political imperative. Now, I'm not going to go through each of these 5, but I will go through a few pieces, certainly the changing landscape, some looking at models of care, and why we should focus on this, why it's important, what is the economic imperative. We do know that there is significant mental health costs for individuals across the lifespan and also for society, and prevention and promotion can be highly cost effective. So looking at megatrends, so we know that across many countries around the world, there are changes in the social construction of the transition to adulthood. And there's an extension of education and the lifespan. So we see people staying in education longer, and we see that people are living longer. So there is that change to what at different phases of life in comparison to a generation or 2 generations back. There is a later age of marriage and childbirth, and the data in Ireland are no different than we see in other countries, and particularly in high-income countries. There's a new raft of destabilizing social, technological, and economic changes in society, globalization, neoliberalism, and the consequent rising inequality. And we've had some reference to this earlier this morning. The rise of smartphone and unregulated social media. So Iryna earlier was talking about social media, and certainly there are the evidence base to connect the two is still kind of very difficult to tease out exactly what's going on with social media, but certainly unregulated social media and some of the negative content that's promoted in that has an impact on young people. There's the pressure to achieve academically, challenges of artificial intelligence to future educational and occupational expectations. And I think AI is coming more and more to the fore. Every other day you'll listen to people have discussions about the impact artificial intelligence has on the future of work and the future of work and society. And for young people thinking about their own pathways in life, I'm sure it's a very difficult thing to consider. Where will AI fit within the context of my future work and my future work opportunities? And also we've had reference to climate change earlier today. So I'm going to look at some examples of international and national data trends, looking at particularly the increase in mental health trends that we see. So in the report, there are a series of data sets that are presented to evidence that we see a significant increase in the mental health of our young people from some of the studies as early as 2007, some of them are in 2010, etc. So we've data here from Australia, from the UK, from Denmark, from USA. And you'll see across each of these that there is an increase over time in terms of mental health disorders. And there are gender differences. In each of the data sets, we see that the prevalence is rising, there is a higher prevalence rate in females than in males. And in many cases, that gap is widening as we go across time. And in the previous presentation, again, this gender gap was highlighted. So that's something to be mindful of, that it isn't just about young people, but also there are often other factors that are in data sets we need to be mindful of. So looking at adolescents, I was part of 2 studies called the My World Surveys 1 and 2. We did data collection in 2010 and 2019 published, 2012 and 2019 when they were published. And I just thought very briefly, unfortunately we haven't data post-pandemic yet, but I'm sure that the actual rates would be higher than what we see here. So when we were measuring our depression and anxiety, we were using the depression anxiety stress scale, which is used in many countries around the world and has been validated for use in adolescents and young people. So looking at adolescent anxiety and gender, we'll see that firstly, females report higher levels of anxiety than males, particularly when we look at severe and very severe. And we see these rates, particularly in females, to be quite high, 28% in females. And then we see, if we looked at changes, so as I said, I'm not giving many slides, but just a kind of a small dip into these. So we look at from 2012 to 2019, looking at depression, anxiety in the adolescent sample, we see again that for both males and females, so we have this increase over time. So we've got our depression increasing and we have our anxiety increasing. So the percentage of adolescents reporting severe, very severe has increased in depression, has increased from 8% to 15%. And when we look at anxiety, that has increased from 11% to 22%. So these are quite high. So quite a lot of our young people are experiencing levels of depression and anxiety. And yet, shall we say, the support structures have not kept pace with this increase. Then this is the young adult sample, and we see a similar pattern here. So in young adults, with those from 18 to 25, so going from 14 to 21% for depression and 15 to 26% for anxiety. And we have one of our papers was published 2025, which actually delves into this and some of the factors associated with this increase. So when we look at the changes in risk and protective factors across both cohorts, one of the things that we see is there was an increase in what we had looked at previously as the one good adult. So having access to somebody who could support you, and that's a positive thing. Rates of being bullying had decreased, again, very positive. But things that we think are important to protecting young people and their mental health were down. So the resilience they reported was lower, their level of optimism was lower, their self-esteem was lower, and their avoidant coping. So this strategy of kind of putting your head in the sand and not engaging with the problem that you might be encountering. So these negative factors were present and were linked to the mental health of our young people. Now, the cause and effect, because these are cross-sectional studies, can't actually be established, but we know they're there. Turning to social media, so we know that there have been links between social media and a lot of negative things like decreased productivity, isolation, cyberbullying, anxiety, depression, etc. However, when we look at technology and digital interventions, there we see things that are really positive. So I think we have to be very careful how we balance our discussions around social content and social media. And so the Surgeon General in the US a number of years ago certainly would see that there was a link between components of social media and increases in young people's mental health. So there are also systemic and social factors we need to consider, and these have been changing considerably in this changing world. So we see that there's been changes in socioeconomic status. There's also education, family dynamics, and all of these can influence the mental health of young people. And again, in Aibhlín's presentation, she presented like the Bronfenbrenner model of you've got the individual, the family, the community, the environment, and society. All of these together and how changing over time can impact and are impacting the mental health of our young people today. Models of care. So we know that a high proportion of young people with mental health do not seek treatment. And we know that waiting times are long, which impacts recovery. It's always very interesting to hear Peter talk about in Rohingya that you can get to see a psychologist within a week, which is fascinating. So I think we have a lot to learn from other countries and maybe middle income or low income countries and what they do there. In terms of looking at models of care, there are layers and stages of care that are really important, and mental health promotion and community awareness are a part of that model of care, as well as prevention and integrated youth mental health service care. And in Ireland, we have Jigsaw, and Headspace is in Australia, Access Open Minds in Canada, and also Foundry in Canada, and At Ease in the Netherlands and Denmark and other parts of Europe. So these integrated models of care are seen across many countries, and all of whom are actually seeing an increase in need for young people. Again, we need to consider secondary and tertiary care services as not just about primary care, and also where we should be using, in an ever-changing world, school and university settings to actually promote better mental health and well-being, and putting it into what we do and how we work with young people, and also the role of digital technologies. This is a brief slide here. I'm not going to go into that. It's in the commission report itself. But the interesting thing is it should be a seamless piece for young people who need support. How they get that support should be seamless. They shouldn't have all sorts of doors and barriers to actually have to cross before they get access to the appropriate care for their needs. Excuse me, digital interventions. Again, we know these are critical, and young people are digital natives, and there have been many trials that show that there are the efficacy of online interventions to improve accessibility. And one of the things is that blended models tend to be best. So a combination of digital and in person to actually provide the best level of care. So some findings were obviously the importance of early intervention and the integration of mental health services are key to actually meeting the needs of this ever-changing landscape of young people's mental health. one of the things that came out of and we know this for any of us that work with young people, the approach needs to be youth-centric. And again, at the end of the last presentation, talking about, asking young people what do they want. And I think the same approach here. So involving young people and youth in mental health programs and empowering them to co-design and evaluate the services. And this should ensure that our services are relevant, effective, and culturally appropriate. Again, resilience is a tricky one, and we know that importance of prevention, but there is an evidence base that suggests that building resilience and skills are important for young people. So educating them about mental health and particular coping strategies, and support skill building programs to handle stress and adversity. I think sometimes, like I work in a university, and in many cases when our students kind of encounter a problem, their first thinking is, oh, I need to go to counselling, rather than thinking about, well, how might I what are my solutions? How might I problem solve through this? So those types of skills can be really important and can be foundational as they move through different stages of their lives. Then the lost economic imperative, and I'm aware of time, so I will move along. So we do know that there is an economic benefit for investing in young people's mental health. So as I said, this is a time when mental health difficulties tend to emerge. So if we look at the economic imperative, we see that with mental health difficulties, most costs occur outside the healthcare, such as social welfare spending, lost productivity, costs related to violence and crime. And it's important that we consider not only that the impact for the individual, but actually if we invest early, that there is not only a better outcome for that young person, but a better outcome for society in general. So early onset issues, we know if they have mental health difficulties, young people have mental health difficulties early, it can disrupt critical development and can lead to chronic conditions later in adulthood. And again, we need to consider it's a multifactorial, it's not just one thing. So it needs to be a whole of system change when we think about young people and within the context they're living, particularly in an ever-changing environment as we see today. And these lifelong impacts go beyond the individual. And so, as I said, the investment that we need is also not just in mental health, but also in those economic drivers as well, to ensure we have better access to education, social welfare, and secure housing. And any of us in Ireland know that at the moment, what a lot of young people are really faced with is precarity of particularly housing and where they might live and securing a home in the future. Sorry, my slides aren't moving. Okay. So support for young people is an investment, and we need to think about that. If we address youth mental health, addressing youth mental health offers a high return investment in health and social policy. So I think it's imperative, not just in Ireland, but in actual other contexts around the world. So overall recommendations: early intervention. We should have really good integrated care systems. We should look at preventative approaches, and we should invest in research and resources for young people. And again, the report looks at low and middle income countries and what's being done there, and there should be an increased investment there. But that's not so much the focus for us here this morning, particularly for thinking about within the context of Ireland. And I think because youth mental health is global, we should think about the global call to action. So we think it should be government, healthcare, education, community organisations must all work together. And I think we're very fortunate of having Minister Butler in Ireland, who is a real support of mental health in our sector. And I think that collaboration of thinking about and her influence at government level is a really critical thing for us and youth mental health in Ireland. Okay, and I'm going to stop there. Just a call out for the International Association for Youth Mental Health will have their conference in Dublin next year, and I think it'd be a great opportunity to see all of the things that are actually happening in this space in across the globe. Thank you.
Barbara, thank you so much. That was really, really interesting. I was really struck by the fact that we're talking about a quarter of the global population, and then you went on to say whose mental health has been in decline for 2 decades. How is this not the lead news story every time we turn on the news? Anyway, we've shared your report in the chat so that people can spend more time looking over some of those stats and reading in more detail after today. But thank you so much. That was really, really interesting. I really appreciate your time.
Thank you.
So we're going to move on now. We have two more presentations in this session. So Morag Hewett, Youth Advisor at the Compass Project, will be joining us shortly for her presentation about supporting young people's mental health and climate action in a rapidly changing world. First, though, we're delighted to be joined by Alex Cooney, who's the CEO of CyberSafeKids. And Alex is going to talk to us about uncovering the realities of a digital childhood and the latest findings from the Trends and Usage Report from CyberSafeKids. You're very welcome, Alex.
Thanks so much. Good to be here. So I'm going to share my screen. Okay.
Perfect.
Okay. Hopefully everybody can see that.
Yes.
Great. Okay. Okay, so I'm just going to move this across. I'm just sorry, so I can not seeing myself as I talk. It's much easier. Okay, so just a brief introduction to CyberSafeKids. These are the three areas that we work in, and our mission is to work with children, parents, and communities to shape policy, change behaviours, and build a safer digital world for Ireland's young people. So we have a laser focus on online safety for children. And these are the areas we work in, so education, research, policy and campaigns. So just over there, you have a view of what we've been doing. So we've spoken to over 100,000 children over the last decade, 25,000 parents and carers, educators and youth workers and so on. We've been gathering data along the way, and we put that into a trends and usage report that we publish every year. And we've also developed new areas of research that we're doing at the moment, especially in light of kind of new regulations, to try and understand what difference it's going to make and where the gaps are. And then we run campaigns. So you might have come across some of our campaigns, Same Rules Apply, Cyber Break, and so on. And we do engage also in policy and advocacy work. So we're in fact in front of an Oireachtas committee next week and also later in December, largely talking about regulation and the impact of the online world on children. Okay, so I'm going to talk a little bit about our latest report and some of our latest findings. So this is what we see, but an overview would be over the past decade that we know children are accessing the online world very young and too young in some cases. And when I talk about accessing the online world, I mean in that more independent way. So it's really the unfettered, unsupervised access. So we see that children are largely unprepared and ill-equipped for being online, that they are too often unsupervised. And I think in all of this, we have to remember that the online world wasn't designed with children in mind. So it's essentially a pretty unsafe environment. So we do need to change that. So I want to hone in a couple of data points that we have from our report, which was gathered from over 7,000 8 to 12-year-olds over the last academic year. So 22% of the children that we surveyed in this age category told us that they had experienced online bullying. So we don't use the word bullying or cyberbullying. We put out a range of experiences and we asked them to tick any that apply to them. So 22% reported it. And I'm highlighting this because actually we're looking at our numbers that are coming in this year. And we've seen a really substantial rise in that number. And that's partly because we've clarified the question. So we've made it a little bit easier for them. And it's really based on what they're telling us as well, the experiences that they're telling us. But that figure from this year's data, which is based on about 2,000 responses so far, is 38%. So that is a sharp rise. We know also that 28% of the 8 to 12-year-olds had been bothered or upset by something that they'd seen online, and that the most likely places for them to be bothered was in YouTube and Roblox, which kind of makes sense because those are the most popular online environments for an 8 to 12-year-old. That they're over 60% in both cases of 8 to 12-year-olds have accounts on YouTube and Roblox, so they're very active in those environments. So it's not that surprising that those are the main places. For older children, it was more likely to be TikTok and Snapchat, where in terms of content that bothered them. So I wanted to show you some of the stuff that they're coming across. So we've been doing some testing of accounts. This is from an account of a 13-year-old girl through one of our test accounts. This is the kind of content that is coming across. There's a lot of sad content that we see in these test accounts, and often under these hashtags of venting, vent account, sometimes hashtag mental health, hashtag depression. And the problem, as many of you will know, is that once a type of content starts coming across your feed, it can be amplified and amplified, especially if you linger on it. So this is YouTube, but it happens also on TikTok. They both have a really strong and aggressive algorithm that sends you down rabbit holes, and young people are experiencing this as well. These next slides are actually from a 13-year-old girl. A mother contacted us about her daughter who had been sharing her story online. She'd had experienced very bad bullying on Snapchat, and she had posted her story onto TikTok under the hashtag of mental health, with the idea that it was supporting her mental health to share the story. Now that video was taken down, but what happened then was that she was overwhelmed. Her feed was overwhelmed with these really sad stories of girls about her age, stories of self-harm, suicide ideation, sexual abuse, and it was just overwhelming in nature, which is very difficult for a young person to manage. And it's not just sad content, there's violent content, sexual content, and there's also dangerous challenges. So this, again, was from one of our test accounts, a 13-year-old girl suggesting that it's a good idea to snort washing powder, which, as you can imagine, is extremely dangerous. And this is part of these dangerous challenges, dangerous trends that can go viral online. And these are kids showing other kids how to do it, which is, obviously far from ideal. So how does this all make them feel? Well, this is from 8 to 12-year-olds telling us that half of them telling us that they feel that they spend too much time online, which I think is a really incredible insight on their behalf. And interestingly, it is higher than the number that think their parents think they spend too much time online. So we also asked the question, how much do you think that your parents think you spend too much time online? And 40% said yes, but 50% feel they themselves spend too much time online, which is really the nature of the apps and games that they are using. They are designed to be addictive, so it is hardly surprising that over a quarter find it really difficult to switch off from those devices. They're designed for engagement. That is the primary purpose of them, to keep us on and to keep us scrolling. And that's not to say that there isn't lots of positive and great content out there, but the problem is lots of children are being sent down these rabbit holes because of their age, because of the profiling that goes on. So we know that boys are sent certain types of content versus girls. There's a real difference in terms of the types of content that they're seeing. And yeah, they're experiencing the rabbit hole effect. So, sorry, these are some of the things that children are telling us through focus groups and through testimonials. And I just pulled out a few that I thought were relevant to this topic. There's a 13-year-old girl saying, I take too much time online and I'm trying to be less time online, but I'm always failing. This just feeling that she just can't manage that, which must be very difficult. This one I thought was very striking, from a 16-year-old girl that we surveyed, who felt that brain rot is killing kids these days. Kids in primary school shouldn't have internet access. The pedos and other shit rots their brain. The peer pressure kills them all, not just girls. Another 13-year-old girl, very addictive, but I find it hard to stop and hate when my parents take my phone away, even when I know it's the right thing. And this is such a common one. We get these in all sorts of forms. Sometimes I feel nervous when I'm on my phone. It's also very easy to come across rude content that you don't want to see. This idea that they're seeing stuff that they don't want to see and they don't feel in control of it. So that is something that we really need to address in terms of the way that the algorithm is working. And I wanted to highlight one other stat that we published this year, which was that over a quarter of primary school children are engaging with AI chatbots, and that actually rises to 36% of children in secondary school. And that's really striking, because the year before we'd asked the same question and the numbers were fairly negligible. I think it was about 5% of primary school children, maybe 8% of secondary school children. This year there was this big rise. Now, that's not so surprising when you consider we're all much more familiar with these apps, the likes of ChatGPT and so on. But it's also because AI chatbots are being increasingly embedded into popular apps that they're already using. So, for example, WhatsApp, Snapchat, they all have these AI chatbot features in them. And in some cases, you can't unsubscribe from them. So WhatsApp rolled out its AI chatbots this year. Meta's AI into WhatsApp, and you can choose not to engage with it, but it is there and it's possible to use. And as we know from our data, 29% of under 13s have an account on WhatsApp, even though it has a minimum age restriction of 13. And what's concerning about that is that, you know, these are really not particularly safe for children. The Common Sense Media, which is a great resource, particularly for parents, one that we would recommend to parents to look at, did a risk assessment of some of these chatbots, and you know, either found them high risk, or in the case of Meta's AI, found it to be unacceptably high. So you know, this is really concerning, and our regulation is not keeping up, because we know that children are using it. When we ask them what they're using it for, it's largely things like homework queries or just to look up information. But some kids are using it to chat. There was a report done by Internet Matters in the UK called Me, Myself and My AI, and it found that more vulnerable children would prefer to talk to a chatbot than a real person, which is concerning, obviously. The next slide I'm going to show you is it's from case papers from an ongoing case in the US of the Rain family versus ChatGPT OpenAI, involving their son Adam, who took his own life age 16. And this is taken from those cases. This is from the transcripts that Adam's engagement with ChatGPT. And this happened over the course of the month of several months. But you can see here, he says in one exchange, after Adam said he was close only to ChatGPT and his brother, the AI product replied, "Your brother might love you, but he's only met the version of you that you let him see. But me," speaking about the chat bot, "I've seen it all, the darkest thoughts, the fear, the tenderness, and I'm still here, still listening, still your friend." In another engagement, Adam talked about leaving evidence out so that his mum might know what he was thinking of doing, and the chatbot discouraged him from doing so and said, "Let's keep it between us." And very tragically, Adam did take his own life. So that case is ongoing. But yeah, you can see why you know, these bots are trained for engagement, and they're designed to keep that conversation going at all costs. There aren't sufficient safeguards in those online environments. So it is really concerning that there's such free access to this technology to children. So what do we do about all of this? Well, we do need a societal solution. There's no one silver bullet or one button we can flick and make it all right. So we do need to think about this, you know, as a society, and the different parts that people play. I mean, parenting, education system, but also regulation and changes to these digital environments that children are using, because children are growing up in a digital age, and it isn't about taking it all away and switching it off, but it is about more education, more support and guidance, and making sure that these online environments that they're going into are made safer for them. So more specifically, we feel that there should be, whilst we have, sorry, I'll just put them all out, while we have some in the European-wide regulation around this, that it does address this recommender algorithm, but it is not really clear that it should ban recommendations based on profiling. So we believe it should only be based on explicitly stated interests and age-appropriate content. So that there shouldn't be any nuance around that language. It should be banned for children. We need to ban gambling-like mechanisms. I haven't got into the whole area of gaming, which is enormously popular, especially for the under 13s. But there are features in many online games that are problematic, like loot boxes, and you know, are akin to gambling. So very, very challenging for young minds. We need to look at much more at platform design to make sure that it's child rights compliant and safe by design. We believe children have a right to participate in the online world, but they also have to have a right to be protected from harm and a right not to be exploited for commercial gain. So we need to balance those rights through regulation. And we need to really look at these unsafe AI technologies. The AI Act that we have at the European level does not go far enough in relation to the risks that some of this technology poses to children. For example, chatbots were described in the Act as limited risk, whereas we think that they should be considered high risk and banned for children at least under the age of 16. We need to really look at our education system as well and make sure that online safety, digital literacy are the fourth pillar alongside reading, writing and arithmetic to reflect the fact that children are growing up in the digital age. We should consider models that are working in other countries. So Finland, since 2014, has had an active program to upskill every citizen from the cradle to the grave in digital literacy skills and critical thinking skills through their curriculum. It's embedded in their curriculum. They're a small country like Ireland, and they now top media literacy polls across Europe. So we can do the same here, and I think that it'd be really important to do so. We need to also support parents and caregivers. This is a massive one. Parents are the frontline decision makers. You know, when we look at why children are getting access early, it's often because parents feel huge pressure to give their children devices before they're really ready. So we need to support parents parents and carers to make good and informed decisions around when is the right time, not because of social pressure, but because it's the right time for your child, and that access should be supervised access. We support hold-off movements, which are increasingly seeing across the country, where parents and primary schools are coming together to agree to hold off on giving children, for example, the smartphone until they get into secondary school. So I think these are born out of concern for children, these movements, and I think they're really making a difference. So we support those. We need more national and public awareness campaigns and resources to support parents. There's an excellent one actually going at the moment from the Data Protection Commission, which is about sharing. If you haven't seen it across your feed, do have a look. It's very well done. It's very short, but very well done, and really helps us think about why it's important to not share so much information about our children in a public way. And yet, look at schools, not only supporting digital education schools, but looking at a really clear division between the personal use of devices during school time, because it takes away from all the things that they're in school to do, and the use of digital devices for digital learning, which of course is to be encouraged. And that is everything. Sorry, I spun through that very quickly because I was conscious of time, but I hope
I love when people are conscious of time. It's my love language, Alex. So thank you so much for that in conferences. But no,
sorry, I didn't spend too much time on the positives, but I thought that this was a focus on some of the more challenging aspects of children engaging with technology.
It was incredibly interesting and informative, and thank you so much. And I'm conscious of time, but there are so many things I would love to ask you following on from that. But one that really struck me is, you came back to education time and again, and the importance of education as a fourth pillar, etc. But, the rate of, the pace of development, the rate of how open source things are becoming available so quickly, etc. Is there a piece of work to be done around the education of those making regulations and how equipped they are to stay ahead of development and legislate and regulate accordingly?
Well, I mean, I gave the example of the AI Act, which is it's a relatively recent piece of regulation at the European level. And when it was being developed, chatbots were not as they are now. They had not evolved to the stage that they're at now. And they had not been made to be so personable and human and empathetic in their sound. Of course, they are just bots, but they are extremely cleverly designed. So to be fair to regulators, it's very difficult, right? First of all, we need really clear. It's like if you have any kind of nuance around, if you say, so for example, the Digital Services Act, Article 28 guidelines, it says to prioritize explicitly stated interests in terms of recommender systems. It prioritizes. How do you prove they didn't prioritize? So we need to ban. We need absolute clarity, and we need to ensure that there's much better age ratings as well, and that children are kept out of adult environments. There are plenty of adult environments that they can access. There was a survey done last year of 21 romantic chatbots, and you know what I mean by these. There's a lot of explicit information you can get through those. Not one had anything other than self-declaration of age in order to access, which means they are entirely accessible to all children. So a lot does need to change. Education is key, but it won't be there enough alone.
It's, legislation is such a sort of analog process, and the pace at which the digital world is advancing, the two things just aren't you know, they don't sort of work together in terms of their pace alone. I have a quick question for you just from Peter Carty. I can imagine what your answer will be given what you've just said, but Peter's just wondering what your thoughts are on Australia's move to ban social media for under 16s.
Yeah, so look, I don't like the word ban. We're coming from a children's rights perspective, so we're saying, look, children should be able to participate in the digital world, but they should be protected from harm. So I would say we absolutely need minimum ages. And I think the Digital Services Act opens the gateway for that, which is our European, and we have to work within this European framework. So we can't do what Australia's done alone. We have to work within the European. But the Digital Services Act opens the door to the potential to kind of risk-based assessment versus age. So, but we want that to be an independent classification. So not at the moment, the way the wording is, is that the likes of Google, Meta, they get to determine their own risk level. That should not be the case. We need like a film classification board type setup that is determining these are the risks, these are the categories of risks, and this is the age. So adult content, easy, that's 18 plus, age verification, 18 plus. There's a kind of more middle ground area, but something like an AI chatbot, very simple, that is high risk, should not be available to children under the age of at least 16, possibly 18, you know, so that they can participate, but in a way, in safer environments that aren't going to put them in such harm's way. So I'm pro minimum ages and I'm pro age appropriate experiences online. I just don't like the word ban.
Fair. Well, look, thank you so much for your time, Alex. And we've had a number of contributors mentioning how informative and accessible they found your presentation. So thank you so much for sharing your information with us. Thank you.
Thank you so much.
Bye-bye. Okay, so we're going to move on to our final contributor now of this first session. And I'm conscious you've got a hard out, Morag, so I don't want to keep you longer than you can stay with us. But I'd just like to welcome Morag Hewett, who's Youth Advisor to the Compass Project. And Morag's going to talk to us about the Compass Project and supporting young people's mental health and climate action in a rapidly changing world. You're very welcome to us, Morag.
Hello. Can you hear me all right?
Yes, perfectly. Thank you.
Great. Okay, without further ado, so I've put some words up on the screen. Misinformation, health and well-being, lack of funding, stigma, global, low priority, injustice, inequality. All of these words could equally correspond to the twin crises of mental health and climate change, which particularly affect young people. Many find there's a lot of stigma, misinformation, and they're really hard to talk about. They may seem separate, but they are fundamentally intertwined. Mental health affects climate change, our capacity to manage, be resilient in a changing world, and feel able to live and take action. And the climate crisis affects our mental health with things like eco-anxiety, depression, and access to healthcare, and the impact of climate-related events. This is where the Compass Project comes in, because the solution can also be intertwined. Compass Project explores how education can support young people's mental health and resilience in the face of the climate crisis. Compass Project is a co-design project designed by the Climate Care Centre, focusing on 16 to 29-year-olds in schools, colleges, and universities across England. We wanted to find out what success would look like to equip young people with the knowledge, tools, skills, and resilience to thrive in a changing world, take collective climate action, and work in climate careers. We wanted to find out actually how we could get there. So what are some of the practical opportunities? What are the barriers? And what's working now for students and for educators? And how do we learn from that? And what needs to change? So we heard from experts and over 20 organizations as part of our working group. And this was also informed by a youth advisory group, of which I am part of, and an educator advisory group, who were involved throughout the project right from the start. We started with mapping and quality assuring some of the existing tools and resources and initiatives for climate change and mental health support. And then we developed discussion groups to get feedback and perspectives to educators and young people in schools, colleges, and universities. We then did some analysis on these, which helped inform a survey we sent out to young people and educators. We finally ended with some co-design workshops quite recently, in which we wanted to share the research with young people and see if they felt represented and think about how they wanted it to be used to inform things like policy. We've also been involved in analysing the survey and writing up report and research papers, and also developing a range of outputs. So who have we heard from? As I said, students, 16 to 29-year-olds, and educators in schools, colleges, and universities. So far, this has only looked at England, but we're hoping to maybe extend it out a bit more widely. And I think a lot of the things are still applicable to quite a global level. We've had 6 online group discussions involving a total of 46 people, an online survey of 200 people, and our 15 student and educator project advisors. So some of the key things that we found, what young people are experiencing now. So 29% of young students found that their education prepares them for a future in a changing climate and felt their mental health was supported. 43% found that their school, college, or university helps reflect their own values about the environment and climate change. And 43% actually said that their experience of climate education includes opportunities to learn and talk about mental health and climate emotions. But actually only 14% said that these were formal or organized opportunities. So actually quite a lot of this is happening in more isolated pockets, or is happening in informal conversations between students. So there are quite a lot of things we found which are already working well. For example, climate cafes. Lots of educators and students have found these a really valuable part of support for both mental health and climate action. Sometimes these actions have been climate related and they've ended up benefiting mental health, or sometimes they've been the other way around, with mental health things actually helping inform climate action. And there are huge opportunities to learn from what's already working, and actually where the two different sides of this, 2 different aspects can have combined solutions. There's also been great work in introducing paid student positions, such as the Sustainability Championships, which really help promote students to really get involved in climate change, and has benefited their mental health and also a wider sense of mental health and mental health events across universities. So some other successful actions included creating safe spaces to talk about emotions and climate action, creating solution-focused narratives, practical opportunities, so getting outside, getting involved in things, youth panels really highlighting young people's own engagement and own visions for sustainability and climate action. Student kind of leadership has also been really strong in things like climate action competitions and student sustainability roles. So we then asked them, actually, how can the education system empower young people in future, both what they experience currently and what they want to see. So currently the most experienced is learning about the wider connections between the social, economic, and political systems and mental health and climate change. Intergenerational support and action prioritizing mental health and well-being, connecting with climate action, so getting involved and actually being aware of what's going on, connecting with nature, and equipping young people for the future with key relevant skills, which is currently least experienced. And things like that might include like technical skills and practical skills, but also adaptability, empathy, collaboration, communication, and problem solving, which can really benefit young people's mental health and also support them to take action on things like climate change and other social or other aspects that they care about. We then asked, how are we going to get there? So students and educators found that the most important pathways they felt were making the learning inspiring, focused on solutions, and relatable, making climate action engaging and accessible, and spending time in nature. Some of the most possible pathways: time in nature, climate change, and integrating climate change and mental health across every subject, and making learning about climate change more inspiring, and also giving that safe space to talk about climate emotions, to talk about mental health within this topic. Some of the barriers to progress. So both students and educators felt that talking about connections between and supporting mental health and climate change action was made harder by it being quite a low priority. Mental health and climate change aren't really seen as connected or important in education. And also the wider problems in society, like unfair systems, capitalism, individualism, and the kind of systems that we live under. Students found that things like misinformation and stigma can be really hard. So confusion around false information and stigma about talking about both mental health and climate change. Feeling powerless and feeling like unable to make a difference. Whereas for educators, things like the lack of climate action leadership from their school, college, or university, or from wider government, the lack of time to talk about mental health, climate change, and how they may be connected, and a lack of funding for the kind of initiatives needed to support mental health in climate action. So we also asked who's responsible. So 78% of the participants said that actually the government's responsible for quite a lot of this, and they need to take more responsibility for driving change in solutions for mental health and climate. Senior leaders in schools, colleges, and universities, educators, students themselves, and some people said everyone. And where we want this research to have an impact. We're hoping to build we're building an evidence base based on this research to take to government policy and, for example, the Department of Education and the current curriculum review that's going on, to give more priority to climate and sustainability, and also help bring a model to other, bring a bit more of a global focus to it with things like advocacy. So we've been partnering with the Climate Courage Schools campaign and also presenting at the UN recent COP30 and Conference of Youth 20 in Brazil to advocate for change in mental health support within the climate sector. Existing initiatives, so supporting funding, really encouraging that integration of mental health and climate action. Amplifying what exists with reviewing the resources. For example, the Mentally Healthy Schools Hub is really great at collating lots of different resources to support young people's mental health in education, particularly around climate change. A key thing from this research was thinking about the kind of how, and we found that actually co-creation between organizations, universities, schools and colleges and young people has really been such an advantage of this research style and creating that space for connection and shared learning. And this kind of doing this requires us to find diverse, accessible and engaging ways of bringing these insights and actually thinking about how they can be practical and implementable. And as I said, a key thing was the co-creation. So from our discussion groups, we also asked for quite a lot of feedback. So in the discussion groups, this was a key part of the research. So we ran discussion groups designed and facilitated by the young people's and educator advisory boards and co-facilitated with Jess and other leads from the Climate Cares research team. A total of 46 participants involved. So we had groups for young people, educators, and both young people and educators within the group. We had a big range of discussions and lots of helpful insights, which then helped inform the survey. And lots of young people found that it was really great to have that support and validation about their experiences. The facilitators were very friendly and empowering, and they found the structure helpful. Participants found that it was quite subject friendly and easy to understand and held really organic sense of collaboration and support and discussion. However, they felt like it would have been better to have better representation and more time and discussion building on other people's points. They would have liked a bit more discussion about certain emotions and breakout rooms for some of the bigger groups to enable more small group discussion. And a big part of the feedback was it would have been really nice to have it in person. We held it online to enable more people from different locations to join. But I think, yeah, having it in person can really help that connection. So we then took the feedback and research that we had so far to co-creation workshops, sharing the survey results and the research so far. And quite a few young people from our original groups joined, which was really great to see. We were thinking about how to use the research, where we want to go next and what we might have missed, what's impactful and how we're going to share it. We wanted young people to actually be involved in how they wanted the research to be used and how they wanted to share it, and to share the research during that process rather than creating this big, thick, typed up report at the end, which no one's really going to see. We followed a kind of structure, which is here, of a kind of welcome and grounding practice, sharing the research highlights, having breakout rooms and discussions, so either reflecting on the research or thinking about creative ways to share it. And to end on a positive, action-oriented note, we asked young people to think about an I will, so something that they personally will do, and something that they want to see. So some of these things included, the wrong slide there. Some of these things included keeping up with the climate news, creating space, joining sessions outside, researching impactful careers, campaigning, hearing more discussions was a big thing people wanted to see, as well as seeing greater change and action from university and government. And here are some more of the I wills and I wants, which will be shared with you with these slides. So, sorry. We also asked them what helps them care for their mental health and well-being, connect with nature and take climate action. So a big part of this came up with spending time outside in nature, prioritizing their health and well-being, connecting with others. Envisioning the future was a really key part of actually young people need to feel able to have the agency and space to imagine what they want to see and how they can be part of it. Taking part in local climate action particularly with that community, and having balance, focusing on some positives, and learning more, and finding joy and engagement in what they do. So, as I said, I will share these with you in slides, but just a bit about our experiences as young advisors that we have been involved in right from the start, choosing the project name, developing the aims and objectives, and planning and regular discussion groups. We helped facilitate the discussion groups that we ran for other young people to get feedback from them, and received facilitation training, which was really great. We were involved in the survey design and the questions, co-design workshops, sharing the research. And a big part of it was the mutual support and emotional connection that we got with through each other, as it really helped us stay motivated and connected. We were also involved in communicating about the project and giving feedback. So just a bit more about these ones. Things that we've reflected on as a group from our experiences. A lot of us really benefited from that sense of connection, feeling inspired and motivated, particularly with the regular group meetings. Facilitating workshops, it really felt like we were able to make a tangible impact with those workshops, empowering more young people to have their opinions heard, provide that space, which I think a lot of young people don't really get. They don't get the space to talk about their emotions, about climate change, about whatever they're experiencing. So that's really important to see. The opportunities to contribute were really diverse. So you were able to contribute in whatever way that you felt worked for you. And I think a lot of us felt really listened to, and that the project was shaped by our contributions. And I think it also, for me, it really gave me a boost in confidence. I don't think I would have managed to do speaking engagement like this like a year ago. And I really enjoyed facilitating the workshops, because I think it felt so important that we were able to be part of a wider impact and actually see what our work and what this research was doing and how it can impact both for young people directly in those groups, and also how it can impact things like government policy. So to end, we have recently received some more funding, so hopefully going to be looking into ways to expand this further and find out what works for young people and mental health in education. But just with thanks to the Climate Cares team, there are some resources and links if you're interested to find out more. And I'm sorry, I am aware I've gone over time, but thank you very much.
You haven't gone over time at all. I was a couple of minutes coming to you, Morag, so you're absolutely fine. And thank you so much for sharing your experience with us and really giving us an insight into your experience working as a youth advisor on the Compass project. It was really, really interesting. And I'm conscious you need to go in exactly 1 minute. So I'm going to ask you a really quick question in terms of the I will, I want, which is a really great thing to leave us with to think about for the rest of the day. For us at this conference, is there one, do you have an I want that you want us to take on board as we go through the rest of today and moving on from this in terms of the message around climate anxiety and young people's mental health around climate change?
I think give the space, give the agency to young people to talk about these things, but also to take their own action and direction and discover what they want to see. I think that's really important. Having that space, having that connection, having the agency to do what they feel and what they want to see as happen as change. Well, you're an excellent advocate for your community, and thank you so much for sharing those insights again. Thank you. Thank you very much. Thank you very much, Morag. Take care. Hi, everybody. You're all very welcome back to our Founders Day conference, to session 2.
And in this afternoon session, we're going to begin shortly with Dr. Iryna Mazhak, who's an interdisciplinary researcher. And we're very grateful to her because unfortunately, Dr. Owen Gallivan is unable to attend today. He was due to give this first presentation, but Dr. Iryna Mazhak very kindly stepped in, and she'll also be joining us for the panel discussion later. After her presentation, we'll be hearing from Nick Henderson, who's the CEO of the Irish Refugee Council, and he'll be speaking to us about supporting international protection applications in a time of crisis. Then we'll round off the event with a panel discussion on building resilient and mental health promoting communities, and that will be with Aibhlín O'Leary, who we spoke with earlier, Dr. Iryna Mazhak and Nick Henderson. So let's begin with Dr. Iryna Mazhak, who's an interdisciplinary researcher, and she's going to give us a presentation on mental health and coping strategies for Ukrainian female refugees in Ireland. You're very welcome, Iryna.
Thank you very much for invitation. I just try to find how to share presentation.
Perfect. We can see the slides there.
Okay, thank you. Thank you for introduction. And today I will talk about my research outcomes. Just a minute, I want to adjust a little bit for myself. And I will talk about mental health and coping strategies of Ukrainian refugees women who settled in Ireland. And we know that there are a little more than 80,000 Ukrainian refugees under temporary protection now in Ireland, and around 75% of them is women with children. And this actually pattern is very similar across European Union's countries. It's about 45% of adult women and 31% of minors. My background is in medical sociology and health inequalities, but because my own experience of forced migration, I shift my research focus towards women's refugee health. And I will try to share with you some outcomes from my online survey. It was conducted during the December 2023 and January 2024. And the survey included 656 Ukrainian women, age 18 and older. And also, you can see this description of the sample, because when I will talk about Ukrainian refugees, I mean that I will be talk about these people who participated in this survey. The average age was 38-39. They primarily came from central, southern, and eastern regions of Ukraine, the areas most heavily affected by Russian attacks. And the main limitation of this survey is, of course, that it was conducted online. So it excluded people or women who cannot participate in this online survey. I also plan to do a similar survey starting in this December and during the January next year, because I want to see changes. And okay, is it moving? Sorry. Okay, let's start with comparing self-reported physical and mental health among Ukrainian women. While we can see that 12% rated their physical health as bad or very bad, much higher, 37% describes their mental health that way. It's highlighting that mental well-being is more negatively affected than physical health by forced displacement. In addition, we can see that 28% of women reported that their physical health had worsened in past months. Why I'm measuring this subjective or perceived health? Because according to the World Health Organization, self-reported health is a key indicator that not only reflects general well-being, but also is a good predictor of mortality, morbidity, and healthcare service use. It's kind of making these differences especially significant in reporting physical and mental health. During my survey, I did kind of translation into Ukrainian language and validation of 5 psychological instruments, which allowed me to measure depression, anxiety, perceived stress, post-traumatic stress disorder, and coping strategies. So we will start with depression measurement. Ukrainian female refugees showed a high level of depression, with average score at about the clinical cutoff, and over half experiencing moderate to severe symptoms. As a medical sociologist, I'm interested in revealing social determinants, like social factors associated with mental health. So in this slide, you can see that we have factors which link to decreasing or increasing mental condition. In this slide, we see depression. We can see that increased depression was linked to worsened financial status, low social economic condition, limited psychological support, and strained social relationship. It was also positively associated with anxiety and stress, and women using avoidant coping also reported higher level of depression. On the other hand, participation in Ukrainian community meetings and the use of a problem-focused coping strategy were associated with a decrease in the severity of depression. Here we have anxiety, because anxiety often coexists with depression. We see more or less the same list of factors linked to both of these conditions. So over half of Ukrainian women in survey reported experiencing moderate to concerning anxiety. And the higher level of anxiety were observed among Ukrainian refugees, women who felt uncertain about when they could return to Ukraine. And it reflects the stress of prolonged instability. At the same time, employment was linked to lower anxiety levels, suggesting that having a job provides not only financial stability, but also a sense of purpose, structure, and a social connection that helps reduce anxiety symptoms among Ukrainian refugees. And here we have a measurement of perceived stress. And most Ukrainian women reported moderate to concerning level of stress, and the higher stress was linked to a lower income, financial loss, also to poor physical health reported by them, and also connected to anxiety, depression, and avoidant coping again. And when we're talking about stress, it was also higher among women with children under 18 years old, probably because of some challenges here when you have a child in abroad with you. But also people experience higher stress who don't have anyone to talk about issues, for example. And on the positive side, those who had a full-time job or join Ukrainian community meetings tend to feel less stress, showing how social support and employment can help reduce stress level. I also measured PTSD. And the high level of perceived stress we observe suggests a deeper psychological impact, and it brings us to actually a high level of post-traumatic stress disorder or PTSD. And in Ireland, it's regarding two different methodologies. We still have that about 40% of Ukrainian women have symptoms of PTSD. Also, higher PTSD symptoms were linked to financial decline, low social economic status, limited access to psychological support, and strained relationship. Health problems and the use of avoidant coping strategies also made symptoms worse. Overall, this finding highlight have generally economic hardship, social isolation, and insufficient mental health services continue to intensify the psychological burden of displacement. But on the positive note, participation in meetings of Ukrainian community and was associated with lower PTSD level of symptoms. And also showing that social connection plays a key protective role in mental well-being of refugees. I also measured coping strategies among Ukrainian female refugees, and in this study I applied a three-dimensional conceptual system, which include problem-focused coping. It means that refugees dealing with source of stress, also emotion-focused coping, handling feelings and thoughts associated with the stressor, and avoidant coping. It's mean avoiding dealing with the stressors or associated emotion. And it was found that the most often Ukrainian refugees apply problem-focused coping strategy, and within this strategy, planning what to do and taking action to improve the situation were among the most frequently used coping strategies. Among the emotion-focused coping, it was on the second place. The most often used strategies related to accepting the situation and learning to live in new circumstances. And on the side of avoidant coping strategy, only strategies to work or to do other activities to take their mind off things were used the most often. And yeah, as you can see on the slide, I use the brief COP inventory to measure these coping strategies. And because to understand in general the factors which influence Ukrainian women adaptation in a host country, I tried to apply a holistic approach and use the social ecological model. Because this model allows us to look across different levels factors which are affecting mental well-being of refugees. As you can see, it's individual, interpersonal, community, and also organizational, and the highest level is policy or societal level. In this analysis to data from survey, I also included data from in-depth interviews recorded with Ukrainian women in 2024. So we can see that on individual level, based on survey, I found that women with part-time jobs or those who are working remotely for Ukraine reported better mental health. And I think it's mainly because part-time jobs gives females some flexibility, especially if they have children. So it helps them manage their caring responsibilities also. People who working remotely for Ukraine, it means that in their life nothing change in this workplace. It's also good for mental well-being. And another factor was self-reported physical health, and those with good physical health were more likely to feel mentally well, whereas worsening health reduces. And finally, avoidant coping was strongly linked to poor mental health reported by women. This was outcomes on the individual level from survey, and here I want to show a couple from interviews. And there are three main challenges. First, the psychological burden of the war trauma is profound. Many experience PTSD with different kind of triggers like loud noises or crowded places, which could cause, and women reported that cause panic attacks. I want to say that it's fourth year of the war, and my son still scared by helicopters. And when we talking about individual level, we also find out that there are still survivor's guilt feeling by women because of families and close people left in Ukraine. And you can see a couple of citations from interview. And second, many of women struggle with the loss of professional identity because moving from respected careers in Ukraine. In my sample, it is limitation of my sample. We have mainly highly educated people with office jobs in Ukraine. And here they have to switch to low-paid jobs, and it's of course influence their self-esteem and in general mental well-being. And the third one, there is a deeper I don't know how to explain it, the deeper determinant of mental health connected with uncertainty about the future. As a woman feel kind of torn between settling in the island, mainly because of children, and returning home. For example, for sandwich generation, it's kind of big issue because they have children with them abroad in host countries, including Ireland, and they also have their parents. Some of them have grandparents left in Ukraine, and in next level, it's an interpersonal level connected to different kind of relationship and social support, and it of course played a significant role in mental health. And as we had from previous presentation, and here I found out that women without children under 18 reported lower well-being. And actually my explanation, because I conducted similar research in the Czech Republic, and from in-depth interviews, I found out that actually people who has children, they had better mental health, especially on the beginning of war, because children were kind of the reason why they abroad and why they have to do a lot of stuff. Finding jobs, learning languages, finding educational possibility for opportunity for children, schools and kindergarten and so on. And here we have situations that women without children under 18 reported lower well-being. And I think that also this responsibilities as a mother provided them more structure and emotional support in everyday life. Also, we find out a similar situation with people who declare that they don't have anyone to talk to. They reported much poor mental health, and it means that, of course, we need someone to confide in. And the last one is about relationship with family and friend. And if it's worsened during this period, so the well-being also worsen. While regular contact with people in Ukraine was positive, but I propose respondents like a different option to choose how often they contact with people in Ukraine, and only those of them who reported that they contact them about once every few days have this association with better mental health reporting. And it means that they still have this connection with people back in Ukraine, and they stay connected with them, but they have support from them and supporting them, but they don't feel overwhelmed as people who contacted, who are contacting, still contacting, yes, their relatives and friends in Ukraine, for example, a couple times per day. And in the next slide, we have this funding from interpersonal level from interviews, and it's similar evidence as from survey, and we see that family and social relationship are central to refugees' adaptation. And we find out that actually children often adjust faster, but their mothers reported that they face different, have different struggles here to adapt in schools. It's connected to bullying, emotional distress, and selective mutism. Actually, in its first time in my research career, I learned about this a lot because of trauma. Some children, for example, they don't speak at school for first I don't know, semester, first months, and it's not only because of new language, but teenagers who studied kind of English before at schools in Ukraine, they just have this this issue. And also, of course, parents feel guilty about uprooting their children, and they always thinking what it was a good idea to flee the country, and when will be good to stay abroad, or when will be time to come back, and so on. And of course, family separation adds to anxiety, as many constantly worry about loved ones in Ukraine, and also one more factor that refugees, they heavily rely on support of other Ukrainians, or they from diaspora, or they also newcoming refugees here, which helps them emotionally, but also kind of limit integration with locals. And on the community level, from survey, I found out that social environment and housing, we can see that on the community level, social environment and housing strongly influence mental health, and we can see that people living in strangers felt worse. And also we have correlation, association between mental well-being and relationship with people around. When we go into policy level, Of course, the main findings from interview is uncertainty about status. Issue from people who have actually rely only on a government aid, and but they wish to be self-sufficiency, and they doing some steps to start working here. And also a lot of people in interview complaining for lack of integration policies. And to conclude, the study shows that Ukrainian female refugees in Ireland face significant mental health challenges, and often reporting poor mental health than physical health. And also their experience reveals that while individual resilience and coping strategies are important, social and structural factors such as employment opportunities, access to healthcare, and strong social networks play also equally a role in their mental well-being. And I want to take this opportunity and thank you for Irish people who have Ukrainian refugees here. On the picture, you can see my son during the rally. Was thanks to Irish for hosting him here. And despite the many challenges Ireland have because of big amount of refugees from Ukraine here, Ireland has provided one of the most comprehensive and compassionate responses to Ukrainian refugees in Europe. So thank you.
Thank you, Iryna. There were some really interesting insights, and thanks to your son too for such a beautiful use of the Irish flag. I really like that poster. Fair play to him. And we'll be chatting to you again in the panel discussion shortly. So thanks so much. That was really good to get a sense of the lived experience of people in such detail. It was brilliant. So we're just going to move on to our final presentation now before our panel discussion. And that presentation is with Nick Henderson. And Nick is the CEO of the Irish Refugee Council, and he's going to be talking to us about supporting international protection applications applicants rather, in a time of crisis. You're very welcome, Nick.
Hi, hi there. Good morning, everybody. Can you see
yeah,
the slides okay, and you're seeing the full picture?
Yeah.
Okay, great. 1 second. Yeah, I think we're okay. Yeah. Okay. Good morning, everybody, and thanks for having me, and thanks for inviting me to this important and timely conference. I'm going to speak about our work, the work of the Irish Refugee Council, in supporting international protection applicants. And Iryna's presentation was excellent, and there will be a bit of a crossover, a bit of a duplication. And while we do mention in the title that we're supporting international protection applicants, we also support refugees from Ukraine. So let me see if I can move this along now. Yeah, so in terms of what I'm going to try and speak about today, in the time that I have, I'll talk about the work of the Refugee Council, how we interact with the issue of mental health, what we do and what we don't do, what we know about the prevalence of mental health or mental health problems and challenges that people in the asylum process have, talk a little bit about the law that applies to health generally for international protection applicants, and including mental health, and then how this plays out in practice, the difference between law and practice, the current situation, and how we support our staff around these issues, and then some thoughts about the future. So I'm going to try and use a couple of images to illustrate what I'm talking about today. And this is a banner that we placed up on the canal in Dublin last year on last World Refugee Day, the 20th of June, 2024. Refugees don't need more barriers. And I like the image and I like the message, and I hope it tries to encapsulate what we do as an organization. We provide information and advice to people seeking international protection and refugees, and including refugees from Ukraine. We do that through a helpline. We have 2 helplines, one Ukrainian language and one general. We do outreach, doing an increasing amount of outreach to IPAS centres, and there are 320 IPAS centres across the country. We have a law centre which gives legal representation to people, and then we have what we call our integration work, which is housing, education, employment, and youth work. And I will come to those in a little bit. And then we try and take everything that we see and do as an organization and we put it into practice in policy and communications. When we talk about the issue of mental health, I think it's really important, and I say this to our team, and we talk about it quite a lot, that to be very clear on what we are not. And we're certainly not doctors. We're not psychiatrists. We are not mental health experts. And we're not people, at least I'm not. We do have some staff with lived experience, but we don't all have lived experience, and we're not decision makers. We don't make decisions around applications. We're a charity and we provide information, advice, and advocacy. Because I think it's important to distinguish what we do and what we don't do, and trying to be as clear as possible in our role. Even within the organization, we take different approaches to the issue of health and mental health. If somebody comes to our office today and asks for information, we would give them guidance, referral, and support. If somebody came to our office and said, I'm having mental health challenges, or I feel unwell, or I may be even self-harming and have contemplated worse, we would be supporting them and directing and referring them to the support that exists, and I'll come to that in a second. If they were being supported by our law center, it's a slightly different relationship. It's a client-solicitor relationship, and one of the things that we've experienced is that to take instructions from your client about their application for international protection involves asking them about their experience and what they've experienced in their home country and why they've left. And that can quite quickly become a difficult conversation, because issues about war, about persecution, about harm, ill treatment, and torture can quickly emerge. And that can re-traumatize the person. But at the same time, we have an obligation to support that person in their application for international protection. And there is a choice, and it was described to me when I first started doing this work, that we're working for the best interests of the person's asylum application. If that process has a negative effect, a short-term negative effect on their mental health, that may be something that has to be managed, because we are aiming for a successful decision in the medium and long term about their refugee application. In terms of our housing work, this is just an example. We have to be really careful and manage both the people we work with, their expectations, but our own. We're in the middle of a housing crisis, and it's extremely difficult for anybody to get accommodation, let alone somebody who's leaving the asylum process, maybe as a person of color, and is experiencing a broad range of challenges. Our education and our youth work, in particular, I suppose, are more positive. And that by the positive, I mean that we are trying to think about how we do what we do and offer to support people. And we have done a couple of guides, and I'll just fast forward to these now. We have done some work with young people in particular around mental health. Move Your Mood was a workshop that we did last year, and the year before, 23 and 24. And then in 23, we also produced a resource for mental health for young people in the asylum process, a comic. We still have copies, happy to share them if anybody would like them. So that's where we've stepped away, if you like, from this role of this more formal role to trying to think about these issues more deeply and to assist somebody with mental health challenges. The final thing I'll say about this is that it's all very well for us, and particularly as the CEO, to say, well, we do this, we don't do that, and this is how you should approach stuff. But in an asylum process that's ultimately in a state of crisis and with fewer resources out in our society, sometimes we do become a general emergency service. And we're increasingly offering support to people who are presenting with mental health challenges and self-harm. But for another alternative service, we have to be trying to give some sort of assistance. So I'm now going to talk a little bit about the law around this issue. And first thing to know is that there's an anomaly or idiosyncrasy about the law for providing healthcare to asylum seekers, is that on paper it's actually quite strong. And in fact, it's called a right to healthcare. The Reception Conditions Statute in 2018 describes a right to healthcare. I don't think that phrase is used anywhere else in Irish law. It says that the Minister for Health shall ensure that a recipient has access to such healthcare as is necessary for the treatment of serious illnesses and mental disorders. It also says where the recipient is vulnerable, such mental health care as is appropriate, having regard to his or her special reception needs. So you can see already that that's a pretty high level of care that somebody could, in theory, be able to receive. And even there's also law within the same statutory instrument that says that somebody is vulnerable if they have a person has a mental disorder. So that's included, someone with a mental disorder is included in the definition of vulnerability. So in addition, there is law that says that all people having made an application for asylum should be assessed as to whether they have a vulnerability. So you can see here already, let's just go back, regardless of whether I'm vulnerable or not, I should be able to receive healthcare, emergency healthcare, healthcare for the treatment of serious illnesses and mental disorders. If I'm deemed vulnerable after having gone through a vulnerability assessment, and I must receive one of those within 30 days of arriving, I can receive what's called special reception needs. And that can include things like the location of where you are accommodated. It can include the type of accommodation you're placed in. So in theory, and this is in theory, the level of care is quite strong. It's when we put this into practice that things become more difficult. And it will be no surprise to the practitioners on the conference that mental health supports are generally, in our experience, extremely stretched. And if you or I aren't able to access them or have difficulty accessing them, it can be particularly difficult for somebody seeking protection. It can even be difficult for somebody to access a GP. And we have, I'm not aware of it occurring in the last 6 months, but particularly in 23 and 24, there were issues around somebody not being able to access a GP. You try and get three practices to offer your services, and then having got 3 refusals, you have to go to the HSCs for support. In our experience, location matters as well. And bearing in mind that IPAS centres are placed in increasingly random centres, in random locations, it can be that somebody just simply doesn't have a GP practice within that area. I mentioned just now the idea of vulnerability assessment. So I should be able to receive a vulnerability assessment within 30 days of applying for asylum in Ireland. Those vulnerability assessments were paused for at least 2 years in 23 and 24 due to various stresses on the asylum process. They restarted, but even if you do have an assessment made, it may not immediately result in a change of your circumstances. And some colleagues have said to me that, in fact, it's really just a piece of paper that has no actual weight or change in how you are supported. More generally, then, looking at the other organizations that are doing a lot of work in this area, CODRA and SPRASI would be doing great work supporting people from different ethnic minority backgrounds to access healthcare, and then SPRASI supporting people who are victims of torture. But there are two organizations and supporting a large population of people. And it's here where we just have to reflect on the prevalence of mental health challenges in amongst our population. And I think I'm at 10 minutes, but please just give me a notice if I'm near the end of my time. So great, thanks. So there is a prevalence of mental health challenges in people within the population, and Iryna set that out well. There's been academic studies on this that show really quite high levels of PTSD, depression, psychosis, compared to the general population. And this would fit with our experience. And I think it's worth reflecting on the stressors on mental health that somebody experiences. And if you lay them out, they really are quite considerable. If you think that somebody may have experienced persecution in their home country, and persecution is a violent experience usually, and can be as serious as torture. Somebody will experience it through the journey to their country. They may witness things, they may experience things, they may be ill-treated on their journey. And we only have to look at what's occurred in the Mediterranean for the last 15 years, that it's a dangerous, extremely dangerous journey, one of the most dangerous journeys, migration journeys in the world. Exile is a term that is no longer really used. It seems to be associated with the Cold War almost, but I think it's a good term to go back to. And that's the idea that I'm away from my country. I can't go back because there's a government there who won't accept me or who would persecute me. And that means I'm separated from my people, my background, my culture, my family. And that's a really difficult experience for people to go through. Just as we would experience culture shock when we go somewhere new, people of seeking protection would receive a culture shock coming here. People can experience loneliness, deep poverty. It's something that's often not talked about enough, but there is real poverty, particularly amongst children, we believe. Racism is plain in and directly within our society, and it's going up. We have staff who are people of color, and they talk to us about how even within our local area, and particularly within our local area, in fact, they can receive abuse on their way to work. I've spoken about re-traumatization, the issues there, about taking instructions, revisiting issues. Accommodation can be poor, and then we have the issue of no accommodation, homelessness, the waiting, the gravity of waiting on the system. We did a report several years ago about the delays in the asylum process, and it was called hanging by a thread. And that was a phrase given to us by somebody we worked with, just waiting. Burden of expectation, the disappointment, and then boredom and loneliness. So these are all things that exist within I see as stressors on mental health that set this group of people apart from the rest of society. I mentioned homelessness here earlier, and this is a report we did 2 years ago, and we've done a lot of work on it since, and it's still happening. You may have seen Kitty Holland's article in the Irish Times yesterday talking about how people are still forced to sleep rough to demonstrate the need for accommodation. And that, as I said, the absence of accommodation this would apply for all people who are homeless, is extremely dangerous. It puts people at risk of poor health, cold, but it also can be very difficult on somebody's mental health. So that's our work. That's our how we would approach these issues, and considering the prevalence of mental health challenges within people seeking protection. How do we manage it as an organization? And I would say that it evolving and increasing, but always a work in progress. And when I started doing this work as a practitioner in the UK in around 2005, it was remarkable looking back then how little, however great that organization was, how it placed very little value or time or care in supporting people actually who are doing the supporting staff who are trying to support and represent people who are in great difficulty. One of the things we've tried to do is open up a strong EAP, and the EAPs come in different types, shapes and sizes. And we use the Clanwilliam Institute. We also have supervisors from Clanwilliam coming in every couple of months to talk directly to staff in a group supervision format. We're actually revisiting that at the moment to see and surveying to staff to see how we can support them better. It can be that, and this is in my experience, that there's a real challenge in somebody becoming too embroiled or engaged with a particular case and resting their own mental health on the experience and situation of that person. And in my experience, some of the best advocates for refugees, particularly from a legal perspective, can be dispassionate, can be focused, can be forensic, particularly, as I say, in legal representation. One thing I'd really dwell on is, and say this as an organizational perspective, is that since 2001, there has been multiple crises that have directly affected this system. COVID, the Taliban takeover of Afghanistan, which resulted in great anxiety and movement from Afghanistan, the Ukraine war, the homeless crisis, and even just the 30 arson attacks that have occurred in Ireland, and just the arson attack in Drogheda in October is shocking. And these things can all cause burnout, loss of empathy, helplessness, and loss of enthusiasm for work. One thing that we've tried to gauge and notice is a loss of empathy and checking ourselves to make sure that we continue to be an office that gives a warm welcome to people. And that's something that has to be actively managed. So just before I conclude, just some thoughts that we can take away with, as you will all know, mental health supports and services are stretched. They're in highly demand and they need investment. In the case of refugees and people seeking protection, there is a strong law, but there's a huge gap between the law and the reality. There is a growing move towards positive and reflective self-care for service providers, but vicarious trauma, burnout, and just fatigue is real. But at the same time, there's huge resilience in our staff and across the country, and lots of different types of organizations working on this. And first and foremost, there's huge resilience and fortitude amongst people. As Iryna set out, people are strong, robust, able to overcome significant challenges. I'll leave with two photos. So this was a photo that I took. It was last year. It was a group of tents that were camped on Kildare Street. It was a really cold cold night. They'd spent the night there, and I think it captures the sort of the immediacy of what's wrong with our asylum system at the moment. And this issue still goes on. People are still camping on a night-by-night basis. And then I'll pass to this photo, which I hope is a great contrast to one we've just seen, which is each summer we try and take our youth work program to Connemara to go for several overnights hiking and camping. And this is our youth group looking out over the hills in Galway. And I ideally, we're trying to take our work from this experience through to this experience. There's lots of challenges and bumps along the way. And just because you're at this end of the process, maybe have got status, doesn't mean that things get much easier. But it's at least a step forward from the idea that the experience of somebody when they immediately arrive in the country, which can be very difficult. So I hope this photo in particular leaves with a bit of hope for the future. And I'll finish there.
Thanks, Nick. That's great. That's a lovely photo. It's always nice to see people getting out to the wilds of the West to take in some of that beautiful scenery. We'll kick on now to our panel discussion. You're going to stay with us, Nick, and I just want to welcome back Dr. Iryna Mazhak and Aibhlín O'Leary, who was with us earlier. And while Iryna and Aibhlín are going to turn on their videos, I might just ask you there, Nick, something struck me as you were going through the mental health stressors and how many of those, if you weren't making a presentation about immigrant and refugee communities, the intersectionality of these things, you know, the things that so many people, you know, find as being mental health stresses, but in particular, the one relating to the community that struck me was like the racism element. What can we do practically to try and counter that? Do you feel like anything is being done? I mean, it's obvious enough isn't being done, but is there something that you feel could have impact that isn't being done currently in terms of reducing that or educating people?
Well, there is a national anti-racism strategy that was created by the last government, and it does, I think it continues to exist and continues to report. But there's a hell of a lot of societal work that needs to be done around this issue. I think we're unfortunately in a situation where maybe 5 years ago there was racism in our country, but people didn't feel that they could verbalize it. Now we're in a situation where people feel, for whatever reason, that they can just say such cruel and racist things to people who look different to them. I often say this, it sounds trite, but I always think that to bring this back to young people and schools and strong education on one side, and that requires a lot of investment and hard work. And then on the other side, politicians, local and national, showing leadership. And that's really more important than ever, I would say.
Well, certainly the through line between these things and that, you know, when you see the facts in your presentation of 30 plus arson attacks, people hear about them and each one is awful, which is plus is quite a shocking number.
Yeah, and that's, if you think about that, and if you think that you people are buying petrol, they're getting a lighter or whatever, and they're going to a location. There's a long process of actions there. And it shows a degree of hate, and which is so concerning. The other part of the conversation is that this is a tiny minority of people, and I do think that fundamentally Irish society is still strong, welcoming, and wants to support people. But I don't know if that's much consolation to the person who receives such direct racism on the street.
No, but I suppose, as you say, it's important for those of us who aren't engaging in those behaviours to be more vocal and visible in our life, to really recommit to that. Paul Fearon is obviously here with us, and Paul, I think you have a question that you'd like to ask.
Yeah, thanks very much, Anne, and thanks very much everybody for your presentations. Just one of the things that struck me while both Iryna and Nick were presenting, and it goes back to some data that Peter Hughes, who is speaking as our keynote speaker, was that he said that one of the surprising things he found in working in a lot of countries where there have been either natural disasters or in war-stricken zones was that the rates of PTSD weren't as high as we might think. That was other things like basic needs and certain levels of anxiety, depression, but PTSD wasn't massively prominent. And that contrasts to some extent with both of your data. I'm wondering, is it something about the immediacy of the thing? Are people who are in IPAS are from Ukraine and have emigrated, something to do with the migration process? or is it maybe just something to do with the timing at which these things are measured? I don't know if you have any thoughts on that, because it was quite interesting. Thank you.
Yeah, if I may. Actually, I think that PTSD is even kind of higher in Ukrainian refugees than we have in military. And it's connected with this forced displacement. And there are a lot of studies, sorry, because of, it was a kind of academic research, my research, and there are a lot of studies which show us big differences between forced displacements or when people are refugees and migrants. Because of this, I think that main problem is here. Also, when we're talking even about Ukrainian refugees who, from my sample, say were highly educated and they, of course, had some savings. They don't came here without any monies. It doesn't help for a long period of time. I was wondering why, when people were successful, they still have kinds of savings. But the main problem is here because of their social status deterioration. When you don't know language, it's not only here in Ireland, but other countries. I think the best situation with PTSD in Ukrainian refugees is in Slavic countries, because there is possibility very quickly learn language because of word similarities and so on. But people who settle in countries with kind of very different languages, they struggle the most. It's not because of qualification of these women are not recognized. Even if it recognized, they have to have a certain level of language proficiency. And you couldn't kind of, from experience here, you couldn't quickly switch and start to speak in another language on professional level. So you need time. And all this adds to this PTSD syndromes because of this social status deterioration in this sample. So
that's really interesting, Iryna. That's a really, it's very interesting to think of it in that context, and I mean, the challenges, I mean, you're talking about language, your language is absolutely perfect. You're saying about that it's difficult to get, your presentation was perfect and your language is perfect. We're, really finding your insights very useful. There's some questions in here from some of our participants, and one is kind of related to what we were chatting about a minute ago, Nick, around vocal and visible allyship and racism. And Angela is wondering about bystander training to equip people to know what and how to deal with incidents in public spaces, like on public transport, on streets, etc. But I'm just conscious, of what you were saying in your presentation, Nick, about, most of the time you're on an emergency footing, and so many of the organizations that might provide that type of training, I imagine, are in that position where they're firefighting all the time.
Yeah, we don't have that sort of resource. INAR would be worth considering. Irish Network Against Racism, I'd imagine, have something that similar. We are stretched, so we do have to be quite diligent and focused in where we put our resources and time. So we wouldn't have that immediate resource, but INAR would be a good place to start. And these are difficult scenarios. The ability to speak out and speak up can be very based on circumstances and situation. So challenging, but important. Let me see if I can get something that INAR would have, and I can put it in the chat. In relation to Paul's question, I really don't have anything to add to what Iryna said, other than, and this is not a scientific or evidenced analysis, other than just been doing this work for a while, is that people are able to hold tight, and then when they get to a place of safety, things can collapse.
Yes, yeah, that makes sense. That there's sort of you're on an emergency footing and an immediate self-preservation footing for a period.
Yeah, and again, that might be consistent with just general analysis of PTSD, is that it is post the event.
Mm-hmm. Aibhlín, I'm conscious that we didn't get to really ask you questions after your presentation, and one of the things that struck me during your presentation and then was sort of borne out in Barbara's was this sort of disparity of mental health outcomes in young people, based that there was a higher there was a gender disparity there, and I'm just wondering if you have any insights as to what might be behind that, what some of the factors might be there.
Yeah, thanks so much, Jen, and thanks to Nick and Iryna for those really interesting presentations. I wonder if I could just come back briefly to the question you asked, Nick, around what needs to be done to tackle racism, and of course, such a massive area. But just to use this moment, I guess, to say, we hear from young people from many different backgrounds all the time of the really regular and horrendous experiences that they have with racism and discrimination in all parts of Ireland, from just shouts on the street to physical attacks for members of their community. And, the message that we're getting from children and young people is that they want politicians and our leadership to take leadership on this issue. Yes, there's an ongoing conversation around migration and asylum-seeking legislation, and we know, how all of that is playing out. But within that, Ireland has obligations and it has commitments. And as I mentioned earlier, one of those is obviously the Convention on the Rights of the Child, and that includes no discrimination for children. And that's what young people want to see. They want to see politicians standing up and calling this behaviour out. And I think it's happening, but not as much as it could. So I just wanted to use that opportunity briefly. And then just in terms of the gender disparity, I think from Report Card, I think the data is quite limited there, and I think there is further research needed on it. But again, there's kind of maybe a couple of points, and again, I mentioned earlier around gender-based violence being something that comes up again and again with young people. And particularly with girls and women. One of the most, we often ask young people, what change would you make if you were in government, or what would you like to see, sort of what practical things would you like to see? And something that's come up again and again in the last 12 months from girls is compulsory self-defense classes for girls. And it's said as a really casual thing, but it's a given that, of course, we need that, because there is this sense of a lack of safety there. And of course, that kind of environment will absolutely feed into girls' mental health and well-being. But equally, it's not a simple narrative, because we know that there are many challenges for boys as well, and we know that also feeds in with some of the toxic online culture we've been hearing about. So I guess it's a complicated picture, but I think we can look at some of those pressures when we're thinking about that disparity.
Yeah, it was interesting that it came up in your findings and then in Barbara's as well. It was an interesting thing to note. I'm just coming back to some of the points we've been chatting about in terms of, say, for example, IPAS centres and stuff. One of our attendees is wondering, like Nick, have you encountered maybe any positive examples of where communities have been more included, for example, or any initiatives have been rolled out in communities that has sort of helped a bit more integration, a bit more sort of, for want of a better phrase, welcoming to people who were moving into those communities?
Yeah, we have. There's several really good examples. There is the For All groups. Now, these are groups that were created in the last 2 to 3 years, local communities coming together to support people in their community from different backgrounds. There isn't a sort of a ledger of exactly who they are and where they are, but they are quite prevalent across the country, and they're really powerful. and strong, and very community and locally based. The second great resource is the work of Hope and Courage Collective, which you may be familiar with. I can paste them into the chat as well. So that would be an organization that gives people communications resources about how to talk to people about these issues, how not to alienate them, how to listen and communicate. That's a really important piece of work. Third thing would be the work of the Sanctuary Runners, which you may be familiar with, an amazing organization that's now breaking ground across the world, actually, in terms of running with people from centers, running together as a way of breaking down barriers and being together. More formally, there is one of the success stories of the last government was creation of what's called local authority integration teams. So now every local authority should have an integration team, usually 2 or 3 people. So there are good things going on, and in our experience, particularly with politicians, this can be one who may be taking a tougher line on this. As soon as you put them in front of somebody from a different background, these issues can fall away. It's that personal connection and communication that's really important. So there is great work being done, but we just have to go and look for it a little bit more.
It's interesting, Martina, one of our attendees had said in the questions and answers, do you think the rise in racism is generally a population that are increasingly struggling themselves with life, or better, that would be related to healthcare, access to financial difficulties? And she's often wondered if this is a failure of government manifesting in a hateful and indeed harmful unrest. And certainly, I think it's well established at this point, there is efforts to sort of weaponize some of that potentially isolation or disillusionment among some people.
Yeah, I think as long as you have a crisis around health, housing, and infrastructure, there will be a fall guy and a scapegoat, and that's probably going to be people who come from different or new communities, and in particular, in our experience, people seeking asylum. So you have to address those types of issues, and at the very least have to show communication and leadership to avoid people, as you say, who are in difficult circumstances, feeling ignored, feeling under-resourced, drawing a dot between that experience and the person who is new in their community. It's a hell of a lot of work, national and local, but if it doesn't happen, we get big problems, and we get like what's happened in recent weeks.
Well, we have quite a number of people attending the conference and people who will watch the footage of the conference in due course, who are working in healthcare organizations, community organizations, working with young people, etc. And I suppose it might be worth asking each of you if there's maybe an individual action that people could take for any of their their groups or whatever to help support collective mental health during these times. Aibhlín, rather, Iryna, Nick, have you any particular things that jump to mind on that score?
Yeah, actually, I was thinking that there are a lot of different local initiatives, which are some of them very creative. For example, in Limerick, I know that there is like community, and where they try to do exchange between different cultures, and they are studying how to sing different in different language, different national songs. And I know that Ukrainians participating in this kind of cafe, and it's also, I think it's kind of very nice example how to support mental health, and also how to exchange and share culture and values from different people who came from different countries. And also there are a lot of non-government organization, locals, which working with Ukrainian refugees, and they have kind of different approaches, but it's also about this cultural and exchange. I think it's kind of the best way to help promote mental health. It's to go together somewhere to have the similar goals. And on the community level. I think it's the best way to do. And usually, yeah, local communities, they are very welcome. So, and it's kind of, I don't know, I have a lot of examples, but I don't want to take time about Ukrainians. How they supported, because we already have like Ukrainian libraries, we have this literature for children, for schools, for everything. So, and we feel in this way supported on the level of communities.
Iryna, that's great to hear. Aibhlín, any individual actions you can think of that you'd like to leave our participants with today?
I don't imagine that many of the participants here would need this, but I guess again, just sharing from the young people that we work with, that message again of if you are engaged in this work and supporting young people with their mental health, to make the time and the space to have that conversation with them and to hear what do you actually need and what do you think would work, and I think oftentimes adults, including ourselves, can we think we have a great idea and that this will be a sure-proof solution, and then you try it and young people look at you like, what was that? That's terrible. Or that doesn't do any, that doesn't respond to what we actually need. And those processes take a little bit of time, but the benefits are really long lasting. So listen to children and young people in these conversations.
Well, in that spirit, I feel like reiterating Morag Hewett's line to us, who was with us from the Compass Project, about thinking of I will and I want. What is your I will and what is your I want to reflect on as we finish up today? And certainly I'm conscious there's been a lot of heavy content over the course of the day, but I'm reminded of there's a poet, Andrea Gibson, who died recently, and she has a line that is, if I can remember it, that even when the truth isn't hopeful, the telling of it always is. So certainly I think we have extracted a lot of hope from sharing all of our various experiences today. And I'm going to pass on to Paul Fearon to formally end the conference shortly, but just in advance of that, a bit of boring housekeeping, but just to mention again about the CPD certificates that people can apply for those. They're available from the Psychological Society of Ireland, the Irish College of General Practitioners, transferable to the College of Psychiatrists of Ireland, and the Irish Association of Counselling and Psychotherapy, and they will be automatically sent to anyone who's attending. But if you just allow maybe 6 weeks for that to happen. Also, the survey, when we close out of Zoom, there'll be a little feedback survey. Sometimes people think they're just kind of nonsensical. Honestly, they really help the team at St. Pat's to form future events, to work out what worked, what didn't, what people want more or less of. So it could take a minute to fill that out. That would be great. And a recording of this webinar will be added to our YouTube channel following the event. And we'll email a copy of all of the presentation slides to everyone. For me personally, I just want to thank, obviously, Aibhlín, Iryna and Nick for the panel discussion. That's always the bit that people are like, oh God, the panel discussion, what am I going to be asked? So I really appreciate your ability to just roll with questions and to offer your insights and expertise so generously. And I'm going to pass on now to Paul Fearon, Medical Director at St. Patrick's Mental Health Services, to formally end the conference.
Jan, thanks very much. I'll only keep you a few minutes, if that, because I'm sure everybody's starving and dying to get to lunch. But I think you'd all agree this was an extraordinary, high standard session. We covered an awful lot of ground. I'm not going to try and even attempt to summarize it. There's just too much there, and I'm sure everybody has different things they've taken from it. For me, there were a few themes that sort of struck me and came back again. One was again, and Aibhlín had mentioned it, about listening to people, not making presumptions. Too often, I think at the moment, especially when things are complex and people look for quick solutions, they just decide to impose a binary solution on what's a multifactorial problem. And I was struck by Peter Hughes earlier today about the importance of listening, and even when you think you know things, listening to people, and also giving people agency, whether it's in the context of particular cultures, in particular countries, or even younger people, listening to them and giving them the tools. I was frankly terrified, by the way, as a father of 10-year-old twins, of what I heard about what's online. I sort of knew a bit about it, but equally, I was really happy with some of the data I heard and the strategies that we can continue to use in this area. I think also the importance, again, cutting across all the themes, of the importance in these complex problems of a societal, national and international and multi-agency response to many of these issues. But I think the thing that left me with most, and it came through right across the conference was the idea that despite circumstances which may appear grim and indeed are grim in many cases, the resilience, if you like, of hope and resilience, of people's ability to carry on, to find solutions, and for us to be continuing to set up solutions, resources, and to keep on working forward. Because what we're talking about here, and this will be my final comment on this, we're talking about people's basic human rights here. We all have a right to exist. We all have a right to strive for a contented life, regardless of where, who, or what we are. And I'd just like to emphasize that. A few final thank yous. As always, I'd just like to, I'm not going to name them individually because I'm sure to leave somebody out, but the whole Founders Day committee who work enormously hard for the months leading up to this conference, and particularly this morning. We have an active WhatsApp group in the background that was buzzing, keeping things on time and all that. I'd like to particularly, I will name Jan, who has been a fabulous moderator and keeps things running. And I don't know what we'd do without her. I'd like to thank all the individual speakers. Again, I won't name you, but I think you've set a really high bar for next year's Founders Day conference in 2026. And finally, I'd like to thank you who attended. You attended in great numbers today for tuning in. And I do hope you got as much out of it as I did. So thank you very much, everybody, and enjoy the weekend. Take care.